FuturePedsRes Midwest Mid-America Region Webinar Series. This is one of our biggest yet, and we are very excited to have everyone here with us today. My name is Chiamaka Nwachukwu, and I am an international medical graduate from the University of Lagos, and I'm currently a junior clinical fellow at King's College Hospital in London.
And my name is Amy Lorber. My pronouns are she, her, and I am currently a fourth-year medical student at Western Michigan University School of Medicine in Kalamazoo, who is represented here tonight. I won't bias us too much. And I am serving as one of the co-directors with Chiamaka for FuturePedsRes this year. And as always, we would like to highlight our founders, Mikola Neela-Canton and Nick Heitkamp, for kicking off FuturePedsRes, getting this whole thing started. Oops, sorry, just navigating the slides here. Here we go. We'd also like to acknowledge Dr. John Frona, who I believe is here with us tonight. He's department chair at CAMC West Virginia University in Charleston, and an APPD member who is really our liaison to the APPD and helps us it's so much we can't even say, as well as Colleen Hughes, who's helped us arrange, and both of these people have made these events possible. We'd also like to welcome the Association of Pediatric Program Directors, of course. We have Dr. Poitvien and Dr. Ayler with us tonight, President and President-elect respectively, and I believe Dr. Ayler is here with us this evening, so I'll let her say hello if she's out there.
I am. Hello, everyone. I just, on behalf of the APPD, want to welcome everybody, extend my deepest gratitude to Amy and Chiamaka and the entire FuturePedsRes leadership, and let all of the applicants know how thrilled we are as an APPD leadership team and as program directors to see that the future is bright and that we have so many students interested in pediatrics. Thrilled to have you all here, and thank you so much for letting us be a part of this series. Welcome, everyone.
Thank you so much. Okay, we also have the Council on Medical Student Education and Pediatrics here with us, and we have Dr. Corinne Lehman here representing them tonight. And I'll give a moment for Dr. Lehman to speak if she's on yet.
Yeah, I'm on. Welcome, everyone. And on behalf of ComSep, we are glad to see the students get to the other side of the journey. So we're here to support, and glad to see that everyone's making their way.
We appreciate it. We appreciate the support. Okay, I want to acknowledge our webinars team and also introduce everyone to our Assistant Director of Webinars, Gloria Ayanda, who will be hosting tonight's session and has helped us immensely in coordinating the Midwest event, which has been a very big coordination effort because we have so many amazing programs tonight. And with that, I will let her take the stage and we'll move on to the Midwest Mid-America portion of the event.
Thank you so much, Amy, for that wonderful welcome. Good evening, everyone. Thank you so much for joining us tonight. My name is Gloria Ayanda. We are so excited to have everyone here at the Midwest Mid-America Regional Webinar. Our series goal for our webinars is providing pediatric residency applicants with foundational knowledge surrounding the virtual interview season, well-rounded insights into the benefits of programs by region, and devoted time for live question and answer. We will soon be transitioning into our breakout rooms. Shortly, in each breakout room, applicants will be able to learn more about various amazing programs and would also be able to take questions in each breakout rooms at the end. All breakout rooms will be recorded, so please check out our YouTube page at the end of the webinar series. And also you can catch up on our previous or prior webinars series that we've had. After that, we would meet back after the breakout room session. We would all come back here to the main room and then break back out to have a residents happy hour, where residents and applicants get a chance to meet and form meaningful connections and also get more insights about residency programs. So it's going to be an informal session. So please feel free to grab a drink, come ready to get all the information and all the insights you need. But before we move on, we would have a brief overview of the Midwest, Mid-America area from the APPD. So I would like to welcome Dr. Ponette Keith.
Hello, everybody. I'm Keith Ponette, and for purposes of tonight, I am the Mid-America Regional Chair. And so I've been asked to, along with Johanna Schur, to give you guys an overview at a high level about what the Midwest and Mid-America region brings to you guys. And we're really excited to be able to share with you guys the things that we think really highlight what it's like to live in Mid-America. And so you can see here the Midwest, between the Midwest and the Mid-America regions, we are about 15 or so states strong. And so we're about a third, despite only being one of despite being only two of the regions, we make up about a third of the country. And so you can see here the geographical range that we have spreading across. And so on the next slide, this is really one of my favorite slides, because this is really the things that many of the program directors think is really important for us when we're looking at your guys' applications as the year comes. And these are the things that we think are really important. So just, take a second and really read through that list, because these are really Midwestern, Mid-America values that we really seek in the residents. Johanna,
thank you. Yeah, thanks. I'll take it from here. Good evening, everyone. I'm Johanna Scheuer. I'm one of the Associate Program Directors at University of Minnesota. And I'm here, I can't take the place of Dr. Emily Borman-Shope, but I'm helping her out. She is the chair of the Midwest region of APPD, and she is sorry she can't be here tonight. These are what the regions, what we're happy about with our training experiences. And as this is two large regions and many programs, there are, as many types of programs as big the region is. So we have academic, community-based, and hybrid programs that have some of each of those. Across all our programs, we are nationally and globally recognized for pediatric expertise in many and all areas of pediatric care. Really a hallmark we're particularly proud of is advocating for all children, and that coming in many shapes and forms across programs. So that's something to learn about as you learn about specific programs in our regions, is the particular ways that we do advocacy work in our programs. Many educational and research opportunities available. And we're also really proud that we're not afraid to try new things and go beyond traditional curriculum. And each program has a number of things that they do that might not be so-called traditional. So another thing we're proud of. Our patient characteristics across 14 states, as you can imagine, there's a very diverse population, and in a number of different ways that diversity can be defined, and that looks different again at every specific program, but is something that's true. A mix of urban, suburban, and rural patients, and again, you're hearing a theme from me that each particular program will tend to focus on one or more of those specific patient populations. So something to find out more from each specific program. Some people are surprised in Minnesota. Some people are surprised surprised to hear that there are large immigrant populations in our state, and that's true across the Midwest and Mid-Atlantic region. And that includes Central America, South America, Southeast Asia, Africa, and a number of places, but not as much as some of the other immigrant populations do have Amish and Mennonite populations. And the next slide. Area highlights. So why do we love where we live in the Midwest and Mid-Atlantic? Really, the 4 seasons is common to all of the programs in this area. And you can see me in short sleeves tonight. It's a hot summer evening. And 6 months from now, I'll be bundled up in a wool sweater, and there's everything in between. And that's something that I really love about living here. It's a very affordable cost of living in these regions, and generally higher resident salaries, in particular as compared to the affordable cost of living. So something to think about. And family and community are really part of the culture, and that goes back to that list of values that we have and that we seek in our applicants. So I hope that gives you a really kind of broad strokes overview of the things you can expect from all of the programs in this region, and can't say enough about and really diving into the specifics of particular places you're interested in.
Thank you so much, Dr. Johanna and Dr. Ponnet, for that. So now we will be transitioning, or we'll be going into our breakout rooms. So just give us a minute as we navigate that, and welcome our participating programs. I mean, we are so excited to have every single one of you here. Thank you so much. Next slide. All right, now these are programs on, these are the names of the programs with their breakout rooms. So we're now going to be going into our breakout rooms. Thank you.
We're going to play some music inspired by the Midwest while we get everyone into their breakout rooms.
Oh,
but we'll pause the music for an announcement. Go ahead.
Oh, just to mention, sorry, to applicants, if you have questions, please feel free to put them in the chat box. And also for program reps, if you're able to answer the questions, please feel free to do that.
Room number 1, my name is Carolina Largo. I'm an international medical graduate from Ecuador, and I'm the assistant director of the IMG equity team here in FuturePedsRes. I'm super excited to know more about the next 5 programs. Just let me share my screen so we could all see the presentation from these wonderful programs. Okay, so someone can see my screen. Yep. Yes, good. So now we have 5 programs. I would like to invite our program representatives to give a short presentation of their programs. Each of you will have 5 minutes, and we'll take questions at the end of all the presentations. Attendees, you can, however, leave your questions in the chat box. And I would also like to encourage our program representative to use the chat box to answer any questions they can in case we run out of time. So without further ado, I would like to introduce the San Luis University School of Medicine.
Thank you so much, Carolina, for that introduction. My name is Brian Glenn, and I'm one of the chief residents from St. Louis University, Cardinal Glennon Children's Hospital. I'm so happy to be the representative from my program speaking with you all tonight, and I'm really excited to field any questions that you guys have, and more importantly, I'm happy that you guys have interest in our program. So without further ado, I'll go ahead and get started. Some of our program highlights include a global health program. It's 2 residents per class, and it's something that you apply for during your first year of residency. We have established global health programs in Kenya and Haiti, as well as Ecuador and India. And we're proud to tout that this has taken place even since the pandemic has started. One of my classmates last year had a really excellent trip to Kenya, and he had wonderful experiences there to bring back and share with all of our co-residents. We have an advocacy track that's also 2 residents per class. It's another one of those tracks that you can apply for. And we have protected time within that advocacy track for you to attend Advocacy Day that's held in the capital of Missouri in Springfield. We have 2 faculty that are kind of the primary faculty to provide oversight for the advocacy track. And it's probably one of my biggest regrets not doing it because they're such a wonderful team, excellent physicians and really knowledgeable and pleasant to be around. Some of the other highlights of the program are our scholarly work. Our residents are constantly being published in prestigious journals, which we're very proud. And we have great oversight from one of our associate program directors, Aileen Tanyos. The CARE is an advocacy curriculum that is implemented during the first year of residency. It's a program in which the residents get to go out into the community and see what services are offered and provided to our patient population, which is generally the underserved patient population. A little bit of background about our hospital. We're a freestanding children's hospital. We have 195 beds. 21 of which are ICU beds, 65 of which are NICU beds. Our NICU is a level 4 NICU. We also attend high-risk deliveries at an adult hospital that has a level 3 NICU there. At our freestanding children's hospital, we have almost every subspecialty available to us. We have cardiothoracic surgery and we have ECMO, as well as a level 1 trauma center. Going on to some of the details of the program, we have 20 categorical residents and pediatric residents and 2 child neurology residents. Our allotment has actually increased in the last 2 years. So our first and second year class now have 20, where previously it was 16. This has been very well received by the residents. It's kind of lightened the load a little bit and allowed for a lot more opportunities in the electives later in the residency. 50% of our graduates go on to fellowship, whereas 50% stay within primary care. And we have a 93% first-time board passage rate. Not included on the slide, but this is something I thought I would mention because I liked to hear it when I was applying for residency. We do have free parking and we do have free food available at the hospital. Just a little bit about our location. I think that overall summary was very good. And it's also true to St. Louis University. We have many affordable options for rental and for purchase within close proximity of the hospital. Generally, people live within 10 to 15 minutes and traffic is really minimal in kind of like a mid-sized city like St. Louis is. Culturally, we have lots of great opportunities. It's one of my favorite parts about St. Louis. We have Forest Park, which is an urban park bigger than the Central Park in New York City. And it houses the Art Museum, the History Museum, and the Science Center, and all of them are free, no paid entry. As far as nature is concerned, another one of my favorite things is all the urban parks, suburban trails, and rivers. I'm a big cyclist, so there's lots of opportunities to do that as well. Our population, as I mentioned, is underserved. We also have a large Somali population and Bosnian population. Our Bosnian population is the biggest Bosnian population outside of the country, actually. And St. Louis has recently been accepting quite a few of the Afghan refugees. A little bit about our curriculum in that we have a lot of individualized curriculum that starts really early on in residency and then is more tailored the further you go throughout residency to kind of cultivate your experiences so that you're best prepared when entering the workforce, whether that's going to be subspecialty or primary care or hospitalist. You have a lot of choice and direction of where you want to go. You do your PICU experience starting in your second year, and you also senior teams is a second year. I think one of the strengths of our program is the amount of autonomy that we give to all the residents, but I think starting as a senior, your second year, we're really, trying to embolden the residents to make decisions and, get their feet wet in clinical decision making. Some of our diversity initiatives are the Diversity Council, and that's something that residents can be a part of. We have regular meetings with the Diversity, Inclusion, and Equity Dean, and we have protected time for the residents to participate in these endeavors.
Perfect.
So
Thank you.
Yeah, you're very welcome. There's our contact information up on the screen. Our program director, Dr. Brooker, and our program coordinator, Teresa Hudson. They're both wonderful. Happy to answer any questions that you guys have in the chat, and excited to speak with you guys more.
Thank you so much. Now we have a Medical College of Wisconsin.
Thank you, Carolina. Excuse me. I'm Mike Weisker. I'm the program director at the Medical College of Wisconsin and Children's Wisconsin in Milwaukee. And I'm also joined by Danita Hahn, one of our associate program directors, who can help chime in for anything I may forget. A few of our program highlights. We ask our residents what their favorite thing about our program is, and they consistently say each other. We have a very close-knit community with a lot of camaraderie, more so than you might think for a program of our size, but they have a wonderful time working and learning together. We consider ourselves the best of both worlds. In the local world, we are the children's hospital for all the kids in Milwaukee who get admitted, as well as the medical home for their outpatient care for both specialty and general pediatrics throughout our city. But we're also a regional, national, and international referral center for many great specialties. One example would be our Hermer Heart Center is internationally known for hypoplastic left heart surgery repair and have an amazing cardiology program as well as many others. We have many resident-led committees in our program and very proud of that, including but not limited to our Diversity, Equity, Inclusion Committee, our Advocacy Committee, Solidarity in Medicine Committee, Wellness, Residency Advisory Panel, Recruitment, and many more committees. We just had a meeting last week we called Committee Palooza for all our new interns to get to learn what committees we had to offer so they could start to join and work with our residents right away. Mentorship is really important in our program. We believe in the concept of the mentor team, and we have wonderful faculty advisors, track mentors, coordinators, associate program directors, chief residents, who are all chosen by some of their great mentoring abilities. We have over 50 different continuity clinic site homes throughout the Milwaukee area and offer many options, including Spanish-speaking only clinics, as well as urban underserved clinics for our residents who are passionate about working in those areas. We have lots of amazing electives to choose from A to Z, we say, from whether it's allergy or advocacy, or going all the way to Z for zany, creatively designed electives by our residents. Every year we have one or more new electives created by our residents to build our repertoire for lots of unique opportunities. We offer individualized curriculum using a track system. We have 8 tracks, which include global and community health, hospital medicine, primary care, specialty/research, career identification track for those residents still trying to figure out where their career path lies, a hybrid of more than one of these, and child neurology for our residents in the combined child neurology program. Going to the next slide, some other details about our program. We have 23 categorical residents per class, roughly 70 total. We have 1 peds anesthesia resident per year for our 5-year combined peds anesthesia program, 2 prelim peds neuro residents, and 1 prelim resident, as well as 6 med peds residents per class. We're a fairly balanced program with about half of our graduates going into primary care and about half going on to fellowship in a variety of great areas with great jobs post-graduation. We're very proud of our diversity initiatives in our program. We have an amazing resident-led diversity, equity, inclusion committee that has separate arms in the areas of curriculum development, community advocacy and engagement, recruitment, and scholarship, and they're doing amazing work each year to build our program. We have an expanding cultural humility curriculum that our residents have helped us develop, as well as new efforts to retain and recruit a diverse residency class. We have expanding LGBTQ plus curricula that is in part due to some of the great work of our residents to expand that. We have a gender clinic experience all of our residents partake in during our adolescent rotation. And we have support for resident leadership development for residents who are underrepresented in medicine. We have some of our residents both in the APPD AIM Scholars Program, as well as the APA New Central Scholars Program, and are very proud of that. And two of our future chief residents are currently doing training with these national resident development programs. We are located in Milwaukee, which is the largest city in Wisconsin and the 31st largest city in America, if you're up to date on that trivia. We have a very diverse population, as well as an active refugee community that was alluded to earlier. Certainly that's very true in Milwaukee. We were rated the coolest and most underrated city in the Midwest by Vogue magazine, as well as we're the home of the 21 world champion Milwaukee Bucks. A lot of great sports, arts, and entertainment scene in Milwaukee, more than you might expect if you're not from Milwaukee. Our residents will encourage you to check us out on Instagram. They have a very robust account there at MTW Pediatrics. And Danita, did I leave anything out that you wanted to add?
I don't think so. You did a great job, Mike.
Thanks. So come check us out in Milwaukee.
Thank you so much, Dr. Weisgerber. Now we have the Sparrow Hospital Michigan State University program.
Hi, everyone. My name is Emily Disbrow, and I also like to introduce, we've got Mike Stifler here, and my chief resident, Savannah Gowan, is here as well. Thanks, everyone, for being with us today. I am going to become program director this year, and we're so excited to have you come and check us out. So we are a really good blend of academic and community experience. We have a wide variety of subspecialties. We have a level 3 NICU with ACGME accredited fellowship and 47 beds. That is our only fellowship. So otherwise you get direct hands-on for all your procedures, all your patients in all our other areas. We have a dedicated PEDS ED that is a level 1 trauma center here in the middle of Lansing, Michigan. We have 12 PICU beds, 41 inpatient beds, and 50 newborn rooms. Our small size really promotes individualized learning. You get, the residents talk about how you get more time and exposure with your faculty and attendings, and it's just a really tight-knit family feel. And we also get procedure experience. We work with attendings from all different kinds of institutions, including Sparrow Hospital, Michigan State University, the University of Michigan, and Helen DeVos Children's Hospital. And we're located right in the heart of the state of Michigan, so in the state capital. So we have a lot of advocacy opportunities with the MIAAP, where Lansing is also really affordable, very low cost of living. And we also have free parking and generous CME money. Our biggest change this year is we have joined the X+Y pilot program. We have implemented a 3+1 model. So our residents have clinic every 4 weeks. And during their clinic week, they have 5 half-day clinics. And then the rest of their half days are expected to do longitudinal curriculum, work on their research. And they also will have a set schedule for appointments and meetings, and they'll know when they're going to be in clinic, so they will have excellent patient follow-up as well. This allows them to focus on preventative medicine and really echoes our program's focus on wellness that we've had. We've always provided a holiday break outside of your vacation. We have a robust pediatric and GME wellness committee, and we have a wellness program that's going to be presented nationally at the AAP conference this year. So this is all resident led and program supported. The program is very responsive to feedback. And this was one of the big goals that our program wanted us to attack this year. We are tight knit. We only have 8 per class. About 44% of our residents enter fellowship, and we have a really strong match record, usually into NICU, PICU, and cardiology, but we have matched to all different subspecialties. 48% of our residents enter private or academic practice, and 8% of our residents become community or academic hospitalists. For diversity initiatives, Sparrow has a chief diversity officer. We also have a GME diversity committee, and we have DEI grand rounds and didactic experiences. We have ongoing efforts to recruit and retain diverse faculty and residents. And we also pride ourselves on our diverse patient population. We have a large amount of refugees, a large amount of urban underserved populations, and residents encounter several cultures at our continuity clinic in the health department. We are also expanding our curriculums in LGBTQ population and in health disparities through our X+Y program, because we have Thursday morning teaching for our inpatient didactics, and we also have Friday afternoon teaching through our outpatient didactics. So lots of protected time for education. And we really love Lansing. We've got Michigan State, we've got a Big Ten university right here. I bleed green. So I had to come back here. We have a diverse population around here. We have a wide variety of restaurants, cultural, outdoor activities. We're in close proximity to Chicago, Detroit, and Grand Rapids, and we're surrounded by the beautiful Great Lakes on all sides. So come check us out. Anything else to share, Dr. Stifler, Savannah?
No, I think you hit most of it, Emily.
No, I think that's
everything.
Thanks a lot, guys.
Thank you, Dr. Disbrow, and good luck on your new chapter as a program director.
Thank you.
Best of luck. So now we have University of Louisville.
Hi, everyone. My name is Becca Hart. I'm one of the associate program directors for University of Louisville and Norton Children's Hospital in Louisville, Kentucky. And I'm very excited to be here tonight on behalf of Dr. Molter, who is our program director. She could not be here, unfortunately. And then our program coordinator, Brittany Luckett. They are both very, very excited to share our information with you. And I'm so glad to be able to be the one to do that. So similar to, I think, what a lot of people have mentioned here, but we are a medium to large residency program with a freestanding children's hospital. Norton Children's has 230 beds. That does include a level 3 or 4 NICU with over 100 beds. So we have a very large and robust NICU and curriculum there. We also have a level 1 trauma center and an ED that staffs about 60,000 patient visits per year. We have a fairly new, just within the last few years, state-of-the-art outpatient center as well, the Wendy Novak Center for Children's Health, which is an awesome all-in-one stop shop for our outpatient clinic, as well as all of our outpatient subspecialty clinics. So really, really beautiful and awesome facility that our residents get to experience throughout their time here. A lot of the things that we're very proud of in our program are our advocacy and DEI initiatives, as well as our distinction track programs. So we have had a very long-standing history of a resident-run advocacy program called PUSH, which stands for Pediatricians Urging Safety and Health. This is an entirely resident-run program with the support of our advocacy director, and residents have monthly meetings, a leadership team. They organize lots of really cool activities, both in our community and across the nation. We participate annually in Children's Day at the Capitol in Frankfort, Kentucky, and we also send residents annually to the AAP's National Advocacy Conference, as well as the APPD conference. And we had our first Ames Scholar this past year. We do have distinction tracks in advocacy, as well as in global health and medical education, as well as research. These are not capped at any particular number. They are open to interested residents. And typically, I would say anywhere from a quarter to a third of our residents each year participate. And those provide for a little bit more of a robust experience in each of those areas. And graduating residents who complete the requirements receive a certificate and a letter in their file. We have a longstanding tradition of international rotations along with our global health. Previously, we've gone to Ghana and Ecuador, but have also supported programs in other areas. And we're very excited to hopefully be able to get some of those back up and running this year in sort of the post-COVID timeframe. Curriculum-wise, we do also participate in X+Y. Our residents do a 6+2 schedule. And so every 8 weeks, they have clinic days, as well as, kind of similar to what people have mentioned, some longitudinal research time, as well as other requirements that they participate in, such as our PACE, which is our communication curriculum. We have a vaccine hesitancy curriculum as well. And we do 13 4-week blocks throughout the year. So that gives us a little bit of extra elective time throughout the year, which is really great for our residents who want to try different subspecialties. We offer a procedure rotation to all of our interns, and which is really highly reviewed by them because they get to basically spend a couple of weeks simply going around the hospital and doing lots of cool procedures. We're actually in the process of completely revamping our career exploration and what we call professional identity and career exploration curriculum, where residents will not only get to try out career paths that they're interested in, but also spend some time working toward sort of self-reflection about what they want from a mentor and identifying mentors, working toward identifying potential scholarly activity projects and more. We do have 24 categorical peds residents per year, as well as 3 child neuro and 5 med peds. We do offer currently 11 and soon to be 12 fellowships. Our fellowships tend to be on the small side though, and I think it's a great balance between having a resident run program, but having fellows available to help you who aren't preventing you from having that first access to your attendings and your patients and procedures. Traditionally, our residents have about a 50-50 split between primary care and fellowships, and we have an outstanding fellowship match rate. As far as diversity initiatives, we do a lot of longitudinal diversity work. We have upstander and unconscious bias training. We have a full noon conference curriculum that we call JEDI, which is Justice, Equity, Diversion, and Inclusion, as well as including an anti-racism checklist for all of our conferences. We have a really cool partnership program with the University of Louisville's undergraduate campus where we can partner residents in a team-wise fashion as mentors to underrepresented minorities in medicine, students who are undergrad and high schoolers who are interested in potentially pursuing careers in healthcare. As far as the location, Louisville is an amazing place to live. It is one of the lowest cost of living areas in the entire country, even amongst the rest of the Midwest. It's a medium-sized city that has a lot of really cool, unique neighborhoods, great park systems, lots of outdoor things, lots of great festivals, arts, and a really awesome local restaurant scene. We are, of course, the home of the Kentucky Derby and the festival surrounding it, which is a whole lot of fun every spring, but there's also a lot more to see in and around Louisville, and is a wonderful place to visit all around. So thank you again, everyone, for your time and for hearing us out. And I'm more than happy to take any questions in the chat as well.
Thank you, Dr. Hart. Now we have the program case, Western Reserve University from MetroHealth program. I think the program director is here, so.
Hi, my name's Phil Fagasti. I'm the program director. Can you hear me?
Yeah, perfectly.
Oh, good. I'm glad to be representing our program here at MetroHealth. I'm glad to also be the only program director I see with a rubber ducky t-shirt on today, so that makes me very happy. I have been the program director here for 2.5 years, but I have been a MetroHealth employee for almost 30 years now. And I came here through the National Health Service Corps, started out working with crack exposed infants in the inner city. And I was so super impressed with MetroHealth and how they truly have walked the walk when it comes to equity and inclusion and healthcare disparities. So I want to tell you a little bit about our program. We have one of the things that I think is most interesting for our program is we have an integrated psychology program, because especially with COVID, but even before COVID, there's so much anxiety, depression, ADHD, and we actually have psychology interns with our residents during their continuity clinics and during our rapid access clinic. So if we have children come in, we don't have to wait 6 months for them to see a psychologist. We walk down the hall and say, hey, we have a kid here who's having some depression. Can you do at least a warm handoff, check to make sure that they're safe? And it's been absolutely phenomenal for our residents to get this kind of really hands-on experience with their clinical psychology team. We were one of the first people in Cleveland to have a pediatric pride clinic, and it includes gender-affirming care, and it includes our endocrine specialty where we do transgender care for our youth. We have a level 2 pediatric trauma center. And one of the things that we're working on really well, we had a great community experience module. prior to COVID, which has really obviously suffered because we can't go out to the community much, but it's opening up this year. And one of our seniors last year is actually going to be heading our school-based health integration. So she's going to be taking on our residents every year when they're doing their community experience module into the schools. She'll be going to a high school and a grade school and doing school-based health within our community, especially in low-income areas. We have a pediatric Hispanic clinic, which is run and fully staffed by Spanish-speaking personnel. We have 3 residents in our program that are Hispanic and then do part of their continuity clinic through this Hispanic clinic. We have as far as our curriculum goes, we have a 13-block schedule, and every Thursday afternoon we have protected didactics. So everybody is cleared from all their clinical responsibilities, and we have people from Rainbow, Cleveland Clinic, MetroHealth, all giving lectures on different topics. And then each resident has half-day continuity clinic each week. But as I talked about before, if you have an interest in neurology, adolescent medicine, or especially our Hispanic clinic, we have many of them who do their continuity clinics within those areas. And next slide. And then we have a small program. We have 8 residents per year, and then we have 6 MedPeds residents each year. So it's a small program. One of the things that I've always liked about it is the integration with the MedPeds, but also what's not on here is I've only been here for 2.5 years, but we have had 100% board pass rate with our residents. And I always thought we were a much more community-based program before I became the program director. And my first year I was here, everybody went into fellowship and got their first choice. So I was like, oh, I guess we do a lot more fellowship than I thought. And so far, everybody who has applied has gotten in, but we are about 60% primary care overall and 40% in fellowship, though that's not on the slide. We have many diversity initiatives. We have diversity leaders in each program with specialized training. So our ACGME program within the hospital has had every one of the programs have leaders in, we call it IDE here instead of DEI. I'm not quite sure why. And so then we are trained, we just started training the trainers. So now all of the trainers in each of our residency programs, not just in pediatrics, will have specialists in IDE. We have an LGBTQ+ integration into our curriculum and into our faculty development. We have just started working with the Pride to do faculty development programs with all of our faculty and with our residents. We have a very large percentage of international medical graduates from all over the world, from Ecuador, and it's truly culturally and ethnically diverse within our residency program. We do have a global health track that we have, and we also open it to any resident who wants it. And as far as our location, before I even talk about Cleveland, which I absolutely love, we have a brand new hospital in downtown Cleveland that is opening in October of, it says 2022, that's correct. And it's going to be a 400-bed hospital with a brand new PICU, brand new NICU. It looks phenomenal. This Thursday, we're going to be able to take the residents in for a tour for the first time. So none of our residents have even seen the new hospital yet. I've been blessed to see the new hospital, and it's absolutely gorgeous. We are situated on a lake with lots of boating and kayaking. I'm very impressed with the Rock and Roll Hall of Fame. I am still shocked when people who live in Cleveland tell me that they have not been to the Rock and Roll Hall of Fame, because it is phenomenal. Our orchestra is the most recorded orchestra in the United States, and we have the 2nd largest theater district in the United States. It's really phenomenal. And talking about outside activities, we have an emerald necklace of Metro Parks, which was just named the best in the nation. One of the reasons I don't mind being here late at night today is because I took time off this afternoon to do a bike ride and a run through the Metro Parks, which are literally in MetroHealth's backyard. And we call it an emerald necklace because it just surrounds Cleveland with all these beautiful, beautiful parks. There's a great cost of living. When my friends from Chicago come, they can't believe I live in a $3 million house because it only cost me $150,000. And it's beautiful. And my wife does beautiful gardening. And we just had a beautiful garden party for our interns. It's a great place to raise a family, many diverse suburbs. And we have, speaking of refugees, we have a very large refugee population, and most of our global health track is working with the refugee population here in Cleveland. We are now rebranding our program because we really have been doing so much of this healthcare disparity work that has truly been since the day I started here 30 years ago. And so we're really trying to showcase all the things we do for our community. We have been given an A as far as giving back to the community, and there were only 60 hospitals in the United States that were given that. And so we're very proud of how much we give back to our community. We have a very fun Instagram that I don't have any clue how to use, but I get to see pictures when we have garden parties and when we go on bike rides, because I force our residents to exercise, which some of them like and some of them don't. So we're thrilled to have you here. It's a small program where you really get to make a lot of decisions on your own, and it's in a great city. So thanks for letting me tell you about it.
Thank you, Dr. Fragasi. Now we have University of Chicago.
Hi, everybody. It's so nice to see you guys, even though it's remote and virtual. And I really wish I had a rubber ducky shirt. It would have been really hardcore if all of a sudden I just like busted out with the other one. But that's my goal for next year then, Phil. Cut me off if you need to. I know we're getting down to the wire, but I'm really excited to share a program with you guys and hopefully bring you, virtually to see us on an interview day and learn a little bit more about us. We are the only level 1 pediatric trauma center on Chicago's South Side, and a really cool setup because we're a quaternary children's hospital within a larger medical center. So my chair likes to call it a free leaning children's hospital. We have our own building and all of the pediatric sort of essences of that children's hospital feel, with child life and murals on the wall and a playroom and all of that good stuff. But we still also have the resources of the larger medical center, right in our backyard. We have a very cool setup, which I am super proud of, and it actually allows our residents to get a really interesting diversity in their training. So home base is Comer Children's Hospital in the South Side of Chicago, but we have 2 other affiliate hospitals that everybody rotates in. One is called La Rabida Children's Hospital, which is a hospital for kids with complex chronic medical conditions. Many are technology dependent. Many are graduates of our NICU or survivors of our trauma bay. And they, have really complex medical needs. And, I think one of the really amazing successes of our field in pediatrics is the kind of survival of kids who, 20 years ago would not have survived. And now you get to actually be part of a network of what is it like to care for those kids longitudinally and over time, and not just in the aftermath of their acute illness or injury. So La Rabida, everybody goes to experience that patient population. And then Evanston, which is north of the city, is a community-based hospital. And I think the real advantage to being in a sort of diversity of clinical environments is not only getting an opportunity to see different patient populations, but also getting to see the same disease process in different institutions. It's a really cool way of developing your own clinical sense of, what's science and what's, just institutional style, and figuring out for you, like, what's your own, personal take on management of asthma and how you're going to handle it in the South Side of Chicago, where somebody may not have resources and may have different housing challenges versus in a more well-resourced community. So it gives you a really nice breadth of experience. We have a lot of well-being initiatives that we've really built into the structure of our program, which I think is really important when we talk about well-being. We have structured afternoons off during all of our inpatient rotations. There are at least 2, and they're not your post-call day or your post-night shift day. And there are really opportunities for you to get the stuff done that is hard to get done when you're working in a hospital, right? So if you have to get the oil changed in your car, or go to the dentist, or make a therapy appointment, all of those are sort of built into the structure of your life so that you can take care of things. And we're really proud of our winter holiday schedule. Everybody gets a full week off, and that is in addition to everyone's guaranteed 4 vacation weeks. So kind of an extra week of vacation. The other half of the residency and the faculty and the fellows kind of pitch in to make it work. And it really does work. And it's lovely to know in the middle of the year especially in the depths of a Chicago winter, you can get a guaranteed week off. And we have an on-site gym, which is in the lower level of our hospital. And that I think is pretty cool because, while we do have the lakefront and all those great opportunities to exercise outside, there is nothing like being able to just run downstairs really quickly, in between clinical sessions or, before or after work. It makes it really easy. We have 4 continuity clinic sites that are in the Chicagoland area. And a couple of the sites are actually for largely Spanish speaking populations. And so that is a really great opportunity to hone your medical Spanish. We're pretty on the larger side of medium or the smaller side of large programs. We've got 86 residents a year. We've got a categorical program, Med Peds, and then we have several scholarship tracks. And if you're interested in either advanced degree in medical education or a Master's of Arts in Public Policy, I encourage you to check us out on our website to learn more about those specialized tracks. It's an extra year of training to get that master's program. But if you're not interested in doing peds over 4 years and you want to stick with a 3-year program, we do have some specialized GME tracks, also in medical education, primary care, and medical ethics. Our diversity initiatives are longstanding, and I'm really proud of them. We have special projects grants to fund your ideas, and we've had a large range of pediatric residents who have gotten their ideas funded, including most recently pronoun badges for all of our residents and faculty. We have a underrepresented in medicine visiting clerkship, and that includes a stipend as well as mentoring and social events with our really incredible, diverse group of residents and faculty. Our residents started a structural competency curriculum a few years back, and that is an opportunity for all of us to really understand the impact of medical racism on our own lives and the lives of our patients, and how we as physicians and caregivers in the hospital setting can actually make a difference and understand what challenges our patients are facing and what our role is in combating them. And that is something that all of our residents participate in. And we have diversity committees with huge resident representation, both at the program level, the departmental level, and the institution level. And our one of our chief residents is actually the co-chair of our house staff diversity committee for the entire medical institution. And I love hearing all the fabulous gems in the Midwest. But I gotta just do a shout out for Chicago. You can't beat it, you guys. I mean, I ran on the lakefront this morning. Lollapalooza is happening right this second. And my brother lives in New York, and he and I have a throwdown every year on who's got the better food. And I still maintain that I think Chicago takes it. Our residents will actually have several outings to explore all of Chicago. They have second Saturdays that are social chairs put together so that folks can experience a whole range of the kind of entertainment that Chicago has, whether it's theater or being outdoors or music or our incredible museum scene. It is all here. And I'm a transplant. I didn't grow up in Chicago, but I have become a diehard Chicago fan. So even though we can't bring you here in person, we would love to show you our program during the interview season. And hopefully I gave us enough time to make it back to the main room, and happy to answer any questions in the chat for you guys. And congratulations on choosing peds. You guys picked the best specialty. I just gotta say, it is such an incredibly meaningful field. And I think the future is incredibly bright for the kids of our world. So thank you guys.
Thank you, Dr. McQueen. And yeah, peds is the best. So now if someone has any question, you're more than welcome to ask before we go back to our main room. Anyone? This is our time, guys. We have program directors here. So if you want to ask something, this is the time. Okay, so well, I have one question. How do you, is open to the floor, how do you help your residents to decide where are their next steps because about fellowship or doing these programs like masters or stay as a primary care what are the advices that you give to your residents? Anyone?
Oh, I'll chime in first. I mean, we don't assign our residents a mentor, they pick them. So they can, if they have an interest in neurology or an interest in hospital medicine, they can do that. And it's very static. So they can change it if they just change their mind as they go on. Obviously, all of us program directors meet with all of our residents or our APDs on a semi-annual basis. And one of the things I always go over are, what are you interested in? How can we help you? And since we're a small program, we have affiliations both with the Cleveland Clinic, with Akron Children's and Rainbow. So if we don't have a cardiologist that has the skills or expertise that they're interested in, then we send them somewhere else. So I think, you know, most programs that will really take the resident under their wing and find out what they want and help them get it.
Good. Good to know. Anyone have any questions? If not, I think we're gonna back to our main room. Just trying to coordinate everything. So just give me one sec. Unfortunately, I don't have the playlist that we were sharing in the main room, but we were playing all the Mid-American music. So I think we're gonna.
I just wanted to add it.
Yeah, of course. Go ahead.
In the meantime, that in addition to our residents having the guidance of a mentor, as well as regular meetings with the program director and associate program directors, we also have a program that's called Residents as Mentors. And that happens as soon as the interns get accepted into the program. And they help with all sorts of things. It does include, you know, career path development and choice, and then, you know, kind of the nitty gritty details about how to apply to those different fellowships, as well as like overall mentorship.
Thank you. This has been amazing, super useful information. So now we're gonna back to the main room. Thank you, everyone.
We're ready to begin Breakout Room 2. Hi, everybody. I am Snimarjot Kaur. I am an IMG from India, and I'm currently working as a postdoc researcher at Mass General Hospital. I serve as the Associate Director for Public Relations in FPR, and I will be your moderator for tonight. We will start with presentations. Every program would get around 5 minutes time to talk about their program, and then we will take questions in the end. Attendees are encouraged to leave their questions in the chat, and programs are encouraged. It'll be nice if you can look through the chat and respond to some questions, but I'm sure we'll get some time in the end to respond to those. Thank you so much, everyone, for being here and for taking out the time to share with us. I would like to start with Advocate Children's Hospital, Park Ridge. Over to you, Dr. Lewis.
Great. Hi. I'm Joanna, and I'm the program director here at Advocate Children's Park Ridge. So it's a little confusing, but there's 2 Advocate Children's Hospital programs. So we are just outside of the Chicago area. The majority of our residents live in Chicago. I'm looking at my own watch because when you share the screen, I noticed that the clock goes away on my computer. So anyway, I think one thing that's great, I'll just tell everyone is, as you guys can tell from us talking to each other, like it's just a big love fest here among all the Midwest programs. We all think that each other does wonderful things. We learn a ton from each other. So that's always a really good place to be in, and in all of pediatrics in general. So just some things about our program. So we're a medium-sized program. Just like most of us in this group today, we have 14 residents a year, so 42 total residents. Samara, is it going to be just this slide or both slides?
It's going to be both slides. I can move to the next slide.
No, that's fine. I just wanted to know what was coming. So we are, so like I said, a medium-sized program. Our residents are a really nice mix of DOs and MDs, about half and half, some international graduates. We have a wide range of ages within our program, which we really like. So some people that have had some previous careers before they came to be with us. We do not have our own medical school, although we have students and M3 students with us all year long from University of Illinois, Chicago, and from Chicago Med. So always a teaching experience. But we do therefore have residents from different med schools. So our 42 residents we have right now, I think the last time I counted, they came from like 36 different medical schools. So a lot of different experiences from med school that they bring here. One thing that we love in our program is really sort of thinking outside the box about education and curriculum development. So I have been privileged over the last 5 years to lead the national X+Y scheduling pilot. So that's been super fun for me. I have gotten to meet wonderful people that also do X+Y scheduling. So we do 3+1 and we really love it. So there's now 40 programs in the country for peds that do X+Y. We also just, we do a lot of other sort of innovative things with that. X+Y scheduling means that every 4th week when you're on your clinic week, our residents have a half day off. So that's really nice, like time to be able to have life and get things done. I also run our mobile health program. So our residents are able to be on our mobile clinic doing a lot of work all longitudinally throughout their 3 years. We have a new refugee clinic that 2 of our residents developed this year, where we're seeing new arrivals to the country unaccompanied, mostly boys, age 12 to 17 for their initial medical exams. So that's also been a really cool new thing to do. We have a hybrid model of academic half day and noon conference. So really trying to meet the needs of both types of learners. We do our academic half day by our clinic week cohort. So you're working just with your group of 10 to 11 residents. We have 2 academic half days a week during your clinic week. So time for some focused learning and discussion. And then also we have noon conference 3 days a week. You can move to the next slide, maybe. Great. So like I said, yeah, a bunch of residents from all over the place. We have about 60% of our residents will go on to pursue fellowships. We have 3 fellowship programs at our hospital, PICU, NICU, and a new hospital medicine fellowship. So those fellows started with us like 3 weeks ago. That has been super fun having them and getting to know them. So it is a nice sort of mix of having some fellows, but also not. And we have done a lot of DE&I work recently, as many people have, which has been exciting. I'm just really sort of taking things to the next level. We are an LGBTQ+ healthcare equality designated hospital, which is wonderful. We do a longitudinal DE&I curriculum and also have affinity groups for different needs and interests within the program. Our residents speak lots of different languages. They're from lots of different places. I always say I'm an outpatient pediatrician. So in one day in my clinic, I could like start out the day wishing I speak Mongolian and ending the day wishing I spoke Polish and being able to speak Spanish somewhere in the middle. So it's a really nice mix of everything like that. We just really love where we work and love what we do. And I feel like my goal for the residents and the goal of our program is just to take each resident from where they start and get them to wherever it is that they need to be. Making sure that, whether it's fellowship, whether it's entering the job market, that 100% of residents figure out who they want to be when they're done and that we help them to get there, which is a really, really exciting thing to do. So, I just think that what I wish for all of you guys is that you find your place. There's lots of great places you can't go wrong. And we're always happy to answer questions to help you find the place that's going to be best for you. Look at that, 4 minutes and 30 seconds.
Thank you so much, Dr. Lewis, for sharing that. It was great insight into the program. I would move to the next slide, I'm going to invite a program director from the Western Michigan University to talk about the program. Thank you.
Sure. Well, hello, everyone. My name is Kelly Brown. I am the program director here at Western Michigan University, or WMed, as we call it. I've been here for about 6 years now, and again, you're going to hear a lot of similar things between programs, right? So we're a small, kind of medium-sized program. We have 10 residents per year. As Dr. Lewis said, we're a really supportive pediatric residency community. And so you'll hear a lot of commonalities and a lot of similarities in curriculum, in kind of structure. And so it's really about finding your fit for the next 3 years of your pediatric residency training. But who are we? So we're here in Kalamazoo, and you may not have ever heard of Kalamazoo, maybe you have, but we are in Southwest Michigan, which is about, well, actually exactly halfway between Chicago and Detroit. It's a really nice place to live. It's about a small, medium-sized city that has 3 different colleges, so affords a lot of opportunities to do activities outside of work as well. Similarly to Advocate, we have a diverse patient population and pretty complex cases that you get a chance as a resident to be kind of the first one to work up patients when they present with a new diagnosis. So I think that's really great for your training. We also don't have fellowships or fellows here at the program. And so you're the one who's providing that one-on-one care for your patients. A couple of things that are unique to our program that I can highlight are 2 things. One is that you are awarded a certificate called the LEND certificate when you graduate from our residency program. And that stands for Leadership in Education in Neurodevelopmental Disabilities. And so the way we've set up our developmental and behavioral pediatrics rotation is such that you do a lot of work with the multidisciplinary team and go out into the Kalamazoo community to see what resources are available for your patients and get to work with those other providers, physical therapy, psychology, autism treatment centers. And so you automatically get this certification upon your graduation. So it's a unique thing. I think we're one of 2 residencies in Michigan who have that designation. So that's one. The other is, like I mentioned, we have 10 residents per year. And 8 of those residency spots are funded in the traditional way that graduate medical education is funded through the federal government. But 2 of the positions are actually funded through the state of Michigan. And so if you match into, you can choose, there's the 8 traditional, and then there's the 2 Michigan positions, which are called MyDocs positions. That means that you're signing up to provide care in an underserved part of Michigan for 2 years following graduation from residency. And that's coupled with some pretty nice loan repayment, so $75,000 in loan repayment. Unfortunately, in Michigan, it's not hard to find an underserved area. And so you pretty much can practice anywhere you choose. One of our graduating residents is likely to stay on here at WMed as faculty when she graduates as part of the MyDocs program. So we can move to the next slide. Let's see. And yes, as I mentioned, I won't read the slide to you. You'll have access to it on the website, and you're welcome to visit our website and our Instagram page for more information about the program. Our residents go on after they graduate to fellowships, to private practice, to general peds. And for us, it's about 50-50, right? So about 50% of our graduates go on to fellowship training, and then about 50% go into general pediatrics or hospital medicine. But again, we look forward to meeting you during interview season, and I'll try to stay into my allotted time as well, and I'll let you go on to the next presenter, but I'd be happy to answer any questions that you guys have.
Thank you so much, Dr. Brown, for sharing that. It was very interesting. I am going to shift to the next program and invite Dr. Pittock to talk about Mayo Clinic.
Unmute. Hello, I am Siobhan Pittock. I'm the program director for the Mayo Clinic Peds Residency Program, and with me this evening is Megan Thorvaldson, who's one of our APDs. So I totally echo what others have shared about the Midwest. You will hear from my accent. I'm not originally from here. And I was blown away in 1999 when I came myself to Mayo, to the Midwest to do residency, just how incredibly welcoming people were. I regularly tell this story, but our realtor, when my husband and I arrived with a 1-year-old and just arrived with our suitcases, our realtor was horrified that we had nothing. We had arranged to meet her so that we could purchase a home, which is very possible for residents here. And she gave us her husband's car because he was away for 3 weeks. Said, well, he's not using it, just use it. And that's kind of the Midwest, that's the Midwest attitude. Those same family, community bonds and values really are true for the Mayo Clinic also. It was started by brothers. And the primary value at the Mayo is that the needs of the patient come first. So that underlies all that we do. We have, I'm not going to stick strictly to the outline of this because, gosh, there's so much to get through. I think what we want to do is make sure that every single resident has as individualized a program as possible. We have 13 blocks per year, and each resident has the opportunity to do 13 and a half electives over their 3 years. So that's a year's worth of electives, 6 of which need to be from specific specialties, but it gives a huge amount of scope for people to have outside of the box kind of elective opportunities. So over the last year, we have had residents do point of care ultrasound electives. We have developed a new artificial intelligence elective. We have one resident who is actually going to complete residency with a certificate in artificial intelligence. We have folks who do away rotations, which are totally funded by Mayo. The Arizona and Florida are particularly popular in February and March, to be honest, but really a great opportunity to individualize your program how you would like it to be. Diversity initiatives are really very, very important for the entire clinic and also for the residency. Mayo has guaranteed a give of $100 million over the next 10 years to work to eradicating racism. And there's a lot of work internally being done and biases in particularly in things like artificial intelligence and the biases that get compounded if we don't work to stamp those out. We have an Everybody In initiative, which is an institution-wide, incredibly rich conversation that happens every Friday at noontime around all sorts of inclusive topics, whether it's Native health, Hispanic health, LGBTQ, just really rich conversations for everybody. There's also zero tolerance of racism, both in the workplace from others, but also from our patients, with really strong work to make sure that if patients are being disrespectful to learners based on any aspect of their being, that we will ask patients to seek care elsewhere. In keeping with that, we have started upstander training for our residents so that they know day one, we do it during orientation for interns, that it's really important for us. So I'm going to pass it over to Megan to talk about our Rochester as a place to live.
Hello, everyone. It's great to be with you tonight. So Rochester is often voted one of the most livable cities in the US. And in my 9 years that I've been in Rochester, I have seen the city change and grow very dramatically, part of Mayo's Destination Medical Center. There's a changing landscape in the downtown area. There's strong focus on community. So in the summer times, you can see us on Thursdays downtown, where it's sort of a market. There's the farmers market every Saturday, which is a great gathering place. Lots of outdoor spaces, so state parks nearby, many miles of trail systems that go through the city and beyond, and then fun breweries, coffee shops, and restaurants that are coming up. So from my home, I can walk to the hospital, to a grocery store, to a brewery, and to a brand new coffee shop that's in a garden center. We're right at 5 minutes right there. Thanks, guys.
Thank you so much, Dr. Pittock and Dr. Thornsville, about sharing about that, and especially about how individualized the training is. I'm very excited to hear about that. I would move to the next program, and I would invite program director and whoever's on the team to talk about USD Sanford Pediatric Residency Program. Thank you.
Perfect. Thank you.
I'm Dr. Jessica White. I'm a neonatologist and the program director here at USD Sanford in Sioux Falls, South Dakota. And with joining me today is Dr. Michelle Bach. She's our department chair and a fabulous advocate for our program. And so I'm going to go a little bit off what my slides say and talk about our program, just because I agree with a number of the things that are similar throughout the Midwest. But I want to tell you about what makes our program unique. And so first of all, our program is housed in a castle, a real live literal castle that is ruled by kids. And so Castle of Care is the location of but it's also the philosophy of Sanford. Sanford is a community-based hospital, but it's also one of the largest rural healthcare systems in the Midwest. And so we take very seriously our commitment both to rural healthcare and underserved populations, but also to teaching the next generation. And so that means that we partner with the University of South Dakota. So we have a large academic center seated right next to our community program. And so we get the advantage of having all of the amenities of both facilities. And so when we talk about what it means to come to our facility and train in our program, that means that you're training in a very small location and the fact that we get to know our residents really well. So we're a small program. We recruit 6 residents per year. We don't have pediatric fellowships, which means that we get to know you one-on-one as individuals. That means not only do we get to know that you want to go into general pediatrics, but we also know that your favorite patient population are 3-year-olds. We know that you have a 1-year-old, and we know that you want to go to Minnesota eventually to serve that patient population. As far as new initiatives, we also think that individualized curriculums are very important. And so what I like to do as a program director is get to know what you're interested in. So not only do you need to be very well rounded as a general pediatrician, but we also have opportunities in research. That includes Sanford Research, which is a freestanding building, and our residents work one-on-one with investigators, including the opportunity to participate in national studies such as those through the Neonatal Research Network. If your passion is in diversity, equity, inclusion, you can join our collaboratives in advocacy and get to know our specific patient population, which you might be surprised to learn includes about a 30% Native American population that we have the honor of not only working with on an individual basis, but also including in our healthcare disparities work. If you like to get to know legislators, we have opportunities in that. We have a new advocacy task force for pediatrics to discuss overcoming health disparities, but we also, as a residency program, participate in Days on the Hill and get to know our legislators. And our residents actually have been successful in either thwarting bills or passing them through our legislation, which is an amazing opportunity and something that a lot of residents don't have the opportunity to participate in. And then if your passion is education, I would love for you to know that we give all of our residents appointments as clinical instructors with USD. And because of that program, we have initiated a new program designed to teach residents how to be teachers and how to be leaders in their healthcare systems in the future. And then finally, we pride ourselves on being very family friendly. And so that means that our residents come to Sioux Falls, and not only do they join our residency program, but they join our communities. And our residents have been featured on Kelloland, which is our local news station, talking about how they have become advocates, but also community members, and they're really valued as such here in South Dakota. And so if you have not yet been to South Dakota, I highly encourage you to come. And I appreciate you taking a peek at our program. And I'll turn it over to the next person.
Thank you so much, Dr. White, for sharing in much detail about the program and about living in South Dakota. I would like to move to the next program and invite Dr. Pitanger, if she's here, to talk about University of Kentucky. I just is anybody from the University of Kentucky program, the program leadership here to talk about the program? Okay, so we will come back to it and hopefully I can communicate with our team to see if somebody's available. I can move on to the next program, Akron Children's Hospital, and invite the program leadership to talk about the program. Thank you.
Hello, everybody. Good to see everybody. Thanks for joining. So I know I'm not on the slide, but my name is Sabrina Benzayan. I'm one of the APDs at Akron Children's Hospital. We are located in Akron, Ohio, so kind of a small town, but near a big city, Cleveland. We are a freestanding children's hospital. We are a community-based program, but university affiliated. Our medical school is NeoMed. So we also train students at our program. We are considered a large program because we have 21 residents a year, which makes us 63 total. We are actually the 9th largest children's hospital in the country. So we have all pediatric subspecialists available at our hospital. We have a number of fellowship programs, but not all programs. As they mentioned before, we do have a large Amish population. Us in Pennsylvania actually have the largest Amish population. And we actually serve quite a few Nepali refugees as well. A couple unique things about our program specifically, as some of the other programs mentioned, we also have quite an extensive individualized curriculum or opportunities to do different electives. Our continuity clinic program is a little bit different. We don't have a specific hospital-based or on-site continuity clinic, which means every resident is placed out in the community for their continuity clinic. So Akron Children's actually owns a multitude of private practices. We're up to about 30, and they're all spread out through Northeast Ohio. So we have the opportunities to have you be at an urban clinic or a more suburban clinic, or a clinic that might serve some of our refugees. And if you want to kind of have a different experience later with your clinic, you can, when you do an ambulatory month, or if you do an ambulatory elective, you can go to a different clinic or work with a different preceptor. I also want to just talk a little bit about Akron itself, but we are, like I said, a small city. I'll echo what everybody else has said. We are the Midwest, which are really nice, down-to-earth people. It's a nice cost of living, very nice surrounding suburbs, but also close to about 35 minutes from Cleveland. So big city with sports teams and theater and orchestra and nicer restaurants and all that good stuff. As well as a very huge park system. So Cuyahoga Valley National Park is actually one of the most visited parks. I also have one of my chief residents on, so I'm going to give him a little opportunity to also say something about our program. So, Carrie.
Yeah, thank you. Hi, everybody. I'm Carrie. So I just want to highlight a few things about this program. One of the things that she mentioned about the sports teams, in fact, one of them is a baseball team, a minor league baseball team, where their stadium is directly outside of our building. So you can see the games from the hospital. And in fact, Akron Children's has a booth there, or a box there, that sometimes they give tickets to residents a couple times a year. So that's been pretty enjoyable too. Two other things I wanted to highlight. One of them being the Amish population that she talks about and that everybody has talked about here has been incredibly helpful. Now that I'm just a recent graduate and I'm going to be taking boards, I hope there are genetic and metabolic syndrome questions on there because of my experience with some of these patients. So that's been very helpful. And then lastly, we have a very robust wellness curriculum, part of that being on Wednesdays on elective. We have a half day. So after we do our noon conference didactics, the residents on electives have a half day where they can schedule other appointments or just whatever wellness means to them. They have that half day off from their elective, and that's on every elective that you have.
We are really excited for you guys to come in and see us. And if you have any questions, we'd be happy to answer those at the end.
Thank you so much, Dr. Dunzine and Dr. Wagner, talking about the program and sharing that with us. I just want to make sure if anybody from the University of Kentucky is available to talk about the program. Okay, so I'm very grateful. This is the end of all the slides that we had. I'm very grateful for everybody who joined and shared about the program. And I'm very glad, per se, to know about the camaraderie, great camaraderie that the Midwest programs share among each other and how welcoming the programs are. And we would be happy to take any questions if anybody has any questions. I see one question in the chat, and I will start with that. So this question is from Anna, and she talks about, she says, I'm Ana Carolini of an IMG from Brazil with more than 5 years of graduation, previous training in pediatrics, and worked as a pediatrician. I'm currently living near Kalamazoo. Is there anything I should do to overcome this specific year of graduation requirement?
Yeah, and I put a quick response in the chat, but we do review all applications holistically. And so while in general, we prefer, a shorter time frame since years of graduation, I think that's on our website, I think the 5 years that she referenced, we do take into account other factors. And so we take each application on a case-by-case basis. Yep. So thank you.
Thank you so much, Dr. Brown, for answering that question. I have a question myself, and I wanted to ask about, is there something for like a mentorship program set in stone for a lot of the programs? Like, how do residents get assigned a mentor, and how does that work? Thank you.
I can speak to that one maybe. What we do is that every single incoming resident is assigned a faculty advisor. We actually are quite deliberate in not assigning a faculty advisor from a potential clinical area of interest. So if you are coming in the door thinking you want to do neonatology, we will assign you an advisor from a different specialty for a few reasons. It will be a way to grow your network of people within the department, because if you're interested in neonatology, you will have no difficulty making great friends with all of the neonatologists. Sorry, I wasn't picking on neonatologists, Jessica. But also, if you do want to apply to a neonatology fellowship, we don't want the relationship at all to feel intimidating. We don't want our residents to feel that they have to always impress their advisor, because that advisor will have a part in their future potential fellowship application. The advisor is to advise on career, to advise on housing, to advise on life, to advise on anything in between. And so each faculty advisor for us also only at any one time can have a maximum of one resident advisee, so that there's so that they really have a chance to develop a good relationship.
Thank you so much, Dr. Patak, for sharing that. Dr. Brown, if you can talk about what you wrote in the comments, and Dr. Benzoin, that would be great. Thank you so much.
Sure. Yeah, we similarly will match you up with a faculty advisor when you enter our program, and they meet with you on a regular basis, as well as myself as program director. I work with you in the outpatient clinic as a general pediatrician, so we meet much more frequently than our formal meetings. But then we also, as someone else mentioned, we matched you up with a senior resident who's kind of your resident mentor as well. So similar to probably what most of us do.
Thank you so much. There's another question in the chat, which talks about, how do you balance considering applications on a case-by-case basis with having to implement filters to reduce a large pool of candidates? Which criteria beyond step 2 CK scores are go-to filters? Thank you.
I can speak to this if you want. I mean, I think that, so hopefully all of you know, because APPD has tried to be very public about this, as well as FuturePedsRes, that, you know, we are all taking time from when applications open to when we would be telling anyone when offers are. So they asked, you know, APPD asked everyone to not send out interview offers till after October 11th. So that would give us like this 2-week window. So we are all, this is our job, right? Like, we all know how to do this. We've been doing this for a long time. We spend a lot of time thinking together about the best way to do this and the best way to look at applications. So we like block our schedules. I mean, I have nothing on my schedule for September 28th and September 29th and September 30th, and then, you know, time throughout there. So all of us on program leadership teams, I would just tell you, Andres, that we're like very invested in doing this and making sure that we do it the right way. So I think the best thing to do is to really be thoughtful about how you apply and how you're using like signaling this year and geographic preferencing and all of that. But the best thing that everyone can do is be thoughtful about how they apply, and that allows us to even be more focused when we're reviewing applications. But there's not like one magic number, I think, you know, that anybody's looking at, especially over the last few years. Everybody has really gone to this different approach, but we want to put in the time. It's worth it to us to be able to review everything. I don't know if anybody, that's sort of the general sense of what we're all doing these days.
Thank you so much, Dr. Lewis, for sharing that, and for sharing in the chat, Dr. Lewis and Dr. White, about the mentorship program. If anybody has any questions, please feel free to unmute yourself. I think that we'd be going to the main room shortly, so feel free to ask your questions right now.
I actually have a question, if that's okay. My name is Brooke. I'm currently a third-year medical student at St. George's. I'm from Michigan, so I'm really much hoping to go back to the Midwest. My question is, since signaling is new, at least new to me, and I know it's kind of new into the application process, how impactful do you think it is to signal as applicants, or like what does that have a role in for your process, I guess?
I think none of us know. This is like the honest truth. It's new. I'll tell you, I sit on the APPD recruitment action team. So when we sit on that team too, we all say like, we think it's going to be good and we don't really know what we're all going to do with it yet. So unfortunately, Brooke, you said you're a third year. So hopefully by next year, we'll have a lot more information for you. But I think the honest truth is we're trying to figure it out. But I think if we all remain committed to what we said, which is that we use signals to look at interviews and not like interview offers and not pass there, which we're all very committed to, I think that would work to everyone's advantage.
And I would say, to be honest, I think like the geographic preferencing is just formalizing what maybe we already we're looking at as a factor, right? Like if we know an applicant is from our home state or home city, then we would assume maybe you would be interested in our program. And so I think this is just formalizing that in a way.
We were starting with Loyola. If you'd like to start over, we have your first. We went over every program that's going to present, so we can just start if you want to, Zach. Thank you. So go ahead, we can restart with Loyola. Sorry about that. I wasn't trying to steal extra time. So as I was kind of highlighting before, just that we are able to offer strong resident support as a medium-sized program. We have a diverse patient population with really great pathophysiology. Part of our resident initiatives have included a wellness committee, a nursing alliance. We have a Care Bridge program that offers free counseling sessions for residents, free of charge and also confidential. The residents want me to point out too that we have a state-of-the-art fitness centers. It's actually within the hospital, so you don't even have to move your car, which I always found was very helpful motivation for me to go to the gym. And that's at a great price for residents. My program coordinator today, Tanya, looked it up and she said it's $37 a month, which is quite good for the amount of amenities and things that it offers. So we are in a block system and we offer 3 electives per year currently. We have daily protected time for our conference for an hour, 1 to 2 hours per day. We do board prep, different boot camps as far as for the interns get their more general teaching lectures that are by themselves, so that it's, you're more able to feel free to ask questions. And then we have a boot camp before our PICU starts, because that's always an elective that residents find anxiety provoking. We're adding a mental health curriculum and having some joint conferences with our psychiatry residents in order to increase our knowledge of that as well. We have a lot of diversity initiatives, including a DEI committee. We sent a representative to the SNMA meeting this year. We have a book club, and there's a funded visiting elective. So as I mentioned before, our main campus, we're located just straight west from the Chicago city limits. So our residents are able to live in a variety of areas, from downtown locations to more suburban locations as well. And we have satellite clinics across the area too that also help you treat more diverse populations as well. So on behalf of myself and I don't know why it's saying Joanna Lewis in the corner, but that's Marcia Ma, my program director. I'm the associate program director, and then Tanya Diaz is our program coordinator, who's awesome.
Wonderful, thank you so much. Okay, I think we're moving on to Central Michigan.
Good evening, everybody. I guess evening for us here on Eastern Standard Time. First off, welcome and thank you for having us. So I think we are the first new pediatric residency program that ACGME remembers in recent memory. So I guess we just started, we got accredited last year, and we have our first class that just started on July 1, and we got through our first block. So we're very happy with how they're doing. We are a small pediatric community-based program. We take 4 residents a year. So we are actually in the process of phasing in. So we have our first group of first years, and we're about to interview for the next class. So in 3 years' time, we anticipate being up to our full complement of residents. We've always had pediatrics here at our hospital system. We have been staffed by family medicine. So I think we are kind of phasing in our pediatric residents, and our family medicine residents are phasing out of some of their pediatric experiences to make room for our pediatric residents, as they've done a lot of pediatrics for us. Saginaw, Michigan is where we're based out of. We are about an hour and a half north of Detroit. So we're a small city, but we're the regional center for pretty much the northern half of the mitten, as we call it here. So we are a regional center for the thumb and the northern part of Michigan. So a lot of the patients stop here and then will either be admitted here, or if they need more subspecialty care, they will be transferred down to the bigger academic centers down south of us. So because of that, we do have a mixture of urban, rural, urban, suburban, and then we do have Amish and international population, similar to a lot of the Midwest cities, just based on just immigrant migrations for work into our states. So obviously, we are community-based. Our goal is really to train pediatricians that want to continue to work in smaller rural communities, because I think that's where the need to access is here in the United States. And so our goal is to try to really have them focus on learning. I mean, you're going to be learning general pediatrics everywhere, but really also focusing on becoming as independent as possible for being in a smaller community. Like Loyola, we also recognize mental health is an issue, and we are actually blessed to have a child adolescent psychiatry fellowship in Saginaw, Michigan. And so we are actually working on creating a curriculum also with our psychiatry colleagues here, because we really feel that we need to be able to extend access into mental health. So our goal is really to not only recognize what mental health issues children are dealing with, but hopefully also recognizing that it's okay for us to certainly start certain medications, or even get them a little bit more comfortable doing some counseling while we're waiting to get them access into psychiatric care. So that's our goal with our program as well too. So on that note, I will pause. Thank you.
Thank you so much, Dr. Chu. All right, Mercy St. Vincent in Toledo.
Hello, I am Lissa Amer, and I'm the program director for Mercy St. Vincent. And we are a small program, level 1 trauma center. We do have helicopters, landing zones. We do have a new collaboration with Nationwide Children's Hospital Toledo, and our rotations are primarily done at Nationwide Children's Hospital Toledo. We do have a 30-bed NICU, 16-bed PICU, a very good simulation center where our residents spend quite a bit of time during our didactics, a very diverse population between the residents, students, and the faculty. And we do have a large underserved population or Medicaid population in our area. Our curriculum, we did move to 13 blocks this year. Being a newer program, we are making a lot of changes and trying to constantly improve our program and make things better for all of our residents. There are didactic blocks Wednesday afternoons with protected time. The attendings cover the floors during that time. And if there's a 5th Wednesday of the month, it's a wellness day where the residents are given a stipend. They can go out and spend some time together. They've gone to the zoo, pumpkin patches, things like that. We're not a covering service, so there's no backup call. The residents who are on electives do cross cover the floor during that time, but otherwise the only rotation that has full overnight call shifts is NICU, and that ends up being about once a week that we have that. We have developed a new parenting rotation that can be taken once during the residency. There's also a board review elective to be done at the end of the 3rd year to help the residents prepare for their boards. And our program does provide the med study question bank. And for our residents right now, the 3rd years are getting the video bank as well, the video series. And we have 4 residents per class for 12 total. There are no fellows at our hospital, so the residents do get the first procedures. There is a small on-campus fitness center, and about half of our residents so far have chosen to go into fellowships. As far as the location, we're probably about an hour from Ann Arbor. We are about an hour and a half from Cleveland, an hour and a half from Columbus. So you have access to many of the bigger cities. There's a large metro park. There's actually one that has some new tree houses that you can rent, some Toledo Symphony Art Museum. So there's something for everyone that's there. And then we do love to have our residents stay here within the system and are constantly trying to recruit them to stay within the hospital system here. Thank you.
Wonderful. Thank you, Dr. Amer. Okay, nationwide in Columbus.
Hello, everyone. I'm so happy to be here to chat about our program, and always to echo some of the other program directors that have spoken, like really excited to see people interested in pediatrics. So my name is Susie Reed, and I'm an associate program director at Nationwide in Columbus. And as you can see on the slide, Dr. Becky Wallahan is our program director. She is currently at a Kids Bop concert with her 2 daughters, so I'm filling in for her. But I'm going to chat very quickly about, well, not that quickly, about our program, and then 2 of our lovely chief residents, Kristen and Melanie, are going to hop on or chime in right after me to talk about Columbus as a city. So Nationwide Children's we are in Columbus, Ohio, which is right in the middle of the state capital. We are a large program. So as the sort of slide says, we're a standalone children's hospital, 600 beds, like, whoa, that's larger than I thought. But we have a lot of, the patient experience, a lot of inpatient, outpatient experience. We serve a diverse community of like the urban population, suburban, and rural. You know, we are the only children's hospital in central Ohio, and so a lot of our patients travel an hour or 2 to get care, and so we also have that urban the rural population. There are our inpatient wards are subspecialty based, and so for sort of a more immersive learning experience, and so you are rotating with specific subspecialists while you're learning care. In addition to inpatient, the residents do an outpatient. They have outpatient continuity clinics, which typically serve an urban, publicly insured population. So highlights of our program. Besides some of the stuff that you can read on our website, I wanted to highlight we have a primary care track for specifically dedicated to people going into primary care, which about half of our graduates, typically around half, do fellowships and half do primary care or general pediatrics in some other way as a general hospitalist in a more rural area. So our primary care track, we also have something called our PECS experience, pediatric experience in a community setting. And that is where our residents in their second and third year spend both half days at different times and block long experiences in private practice pediatrics. So it allows people to really see the full scope of primary care in the clinic setting with publicly insured patients. There's a different families have different needs and different questions. And so this is an opportunity to serve a different population in the private practice setting. So our RECE experience, Residents in Schools initiative, so in different in electives and some other outpatient blocks, residents spend time in our local elementary schools, in Columbus City schools, and spend time teaching second and third graders about healthcare related things. And I was a resident at Nationwide, formerly Columbus Children's, many years ago, and RECE was one of my favorite experiences as a resident. Additionally, in addition to those experiences, we also have what we call an advanced competencies program. So this is an optional program for residents who are interested in gaining skills outside the things. So I'll try to remember all of our advanced competency experiences. So research, medical education, global health, advocacy, bioethics, informatics, quality and safety, and there is another one and it's escaping me. But this is to, these programs are a little bit different depending on the advanced competency, but again, this is work outside of your classic residency schedule that gives you experience and skills in those other arenas if you're interested in having that as a component of your career long term. Gosh, what else? It's really fun. It's a fun place to be. It's a fun place to train. I have been there for a long time. I did my residency and fellowship at Columbus Children's, now Nationwide Children's, and been on faculty for 10 years. So I'm going to stop blabbing and turn it over to Melanie and Kristen to brag about Columbus.
Hi guys, yeah, we just wanted to share some things that we love about Columbus. It's a very rapidly growing city. I think it's the 14th most populated in the United States, and it's the second most populated city behind Chicago in the Midwest. Because we're in the capital city of Ohio, there's a lot of unique advocacy opportunities, which I think are really fantastic. And then we're home to many colleges and universities, the most famous of which is the Ohio State University. So you get to have like a lot of young people around you who are all academically minded, and it's very nice. And I will turn it over to Kristen now.
Hi guys. I also love to brag about our Metro Park system and a lot of the outdoor stuff we have. I have a dog, and a ton of other residents and Columbus residents in general have dogs. We have a ton of Metro Parks. We're about an hour away from a great state park. And then up near Cleveland is the Cuyahoga National Park. So we're pretty close to that too. The cost of living here is quite reasonable, especially for the degree of amenities that come from living in a city like Columbus. You can drive everywhere, park anywhere, fly anywhere, and like hardly have to get to the airport before your flight to get through security. So it is a lovely place to live, and Nationwide has been a lovely place to train. Would highly recommend.
Thank you so much, guys. I really appreciate it. That was awesome. All right, I think next we have IU.
Hi, thank you so much for having us. We appreciate it. My name is Sarah Kane. I am the new program director for Indiana University. I'm taking over for Dr. Rushton, who has been our program director for the last 19 years. And I have big shoes to fill, and I'm excited to get to have the opportunity to meet all of you. I'm a neonatologist, and I'm actually on call tonight, so that's why I'm in scrubs. I don't routinely hang out in scrubs or in the hospital, but that's where I'm at tonight. So I'm really excited to talk about our program here. We've been ranked this year 10 out of 10 pediatric subspecialties by US News and World Report. We are a medium to large size program, so we have 25 categorical peds residents per year, 14 med peds residents per year, 2 combined peds EM residents per year. We have triple board residents, child neurology, NDD residents, and peds genetics. So it actually brings up our cohort to about 50 residents per year. Because of all that, we really have all of the amenities of a large children's hospital with every subspecialty that you can imagine. And so like some other programs I talked about are inpatient wards. We have a few general wards, and then the others are kind of grouped by cardiology or pulmonology or GI, spending time on those subspecialty rotations. We are the freestanding children's hospital. It's at Riley Children's Hospital. That is the largest children's hospital in the state of Indiana. And so we get a really large encatchment center and get patients from all over the state of Indiana referred in to us for care. We have all of really strong community networks for all of our outpatient and continuity clinics. We have a primary care track with our residents being able to spend time at outpatient centers across the state. And we're also starting some other clinical tracks as well. So a critical care track, a peds emergency medicine track, and a subspecialty track for those residents that are interested in going into those fellowships. Last year, about 63% of our alumni went on to fellowships. That's usually, we're about 50-50, although it can change year by year. We're consistently ranked the #1 clerkship by IU School of Medicine, and IU School of Medicine is one of the largest medical schools in the country. So it's really a privilege for our residents to get to be able to teach all of our medical students that we come rotate through. And our Department of Pediatrics is ranked #6 in the United States for NIH research funding. And we're very proud to have a strong physician scientist training program here. So residents who are interested in research have the opportunity to get involved and even to do pathways such as the integrated research pathway or the accelerated research pathway through the ABP. We also have support for underrepresented in medicine visiting students. We have campus-wide GME training, partnership with SNMA and LMSA, and recruitment and retention incentives for our residents who are underrepresented in medicine. We have lots of resident leadership in our DEI committees. We also are in the state capitol and have a great opportunity for advocacy for our residents. And our residents serve on hospital-wide committees, including patient safety, quality improvement, and research. And being in Indianapolis, it's a really fantastic city. I did my initial medical school training and residency training on the East Coast and came out here for fellowship and was just blown away by all of the large city amenities that we really have here in in the Midwest, but really with a nice, livable, friendly vibe. Very low cost of living for our residents. A lot of our residents choose to stay here for either fellowship or for job faculties or to stay in the surrounding areas after they're done with their training. Very excited to take over for this position, like I said, and very excited to answer any questions and to welcome you all to our program.
Thank you so much, Dr. King. Wow, I'm really being sold on the Midwest here. Okay, and now we have UNMC and Creighton.
Great. Well, I will echo what everyone else has said and just say welcome. I'm so excited to be here tonight and share a little bit about the University of Nebraska and our residency program with you. So I'm Nate Goodrich. I'm a pediatric hospitalist here in Omaha and one of the co-program directors of our residency program. I do that with Dr. Lisa Siskowski, who's also a hospitalist, one of my partners. She couldn't be here tonight. She's on a family vacation. So I am doing this solo tonight. And then Cindy and Brooke Seaton's, her picture's not on here. They're our two coordinators. If you have any questions at any point, they can help you with just about anything you could possibly think of with our residency program. So we're situated in Omaha, Nebraska, and one of the questions that may come to mind is, well, what is in Nebraska? If you've not been to Omaha before, and Omaha is actually a city of about 1 million people in the metro area, so a decent sized city, and so you get all the amenities that you'd expect in a city of that size, but Omaha very much maintains a smaller feel to it. It's something, I don't know, we all think is unique to Omaha, and I think our residency program really echoes that. Some things that we really would like to highlight about our residency program. We do have a few tracks that are available in our program. We had the opportunity to sort of reimagine a couple of these this year, and I'll touch on those in just a second, but our global health track has been in place for quite some time. It's of course looked a little different during COVID, but this is a longitudinal track that's faculty-led that our residents can participate in and have the opportunity to participate in an elective clinical or research experience abroad. And again, pre-COVID, had lots of residents that took advantage of this. And even despite COVID, the faculty that lead this have still been fairly creative in making this a meaningful experience. We are affiliated with both the University of Nebraska and Creighton University, as well as our freestanding children's hospital. And so that does put this in this sort of unique position in that we are working with medical students from two separate universities. And one of the things that our residents really enjoy about our program is the focus on education that they get and really being trained as residents as educators. And so we really appreciate and enjoy watching our residents become these very skilled teachers over the course of residency. One thing that you might be right about if you were assuming things about Nebraska is that there is a lot of rural pediatrics that happens in the state of Nebraska. And so we do have opportunities for our residents who are interested potentially in a career in rural pediatrics to participate in either week-long or month-long rural rotations. And have residents that take advantage of those who are thinking that they might want to practice in a rural setting. For those residents who have an interest in research and see that as part of their career, we are very lucky to have what's called the Child Health Research Institute, or the CHRI. It's essentially the research infrastructure of the Department of Pediatrics at UNMC. With that comes resources such as grant writing, people to help with that, statistical support. There is internal grant funding that's available to our residents. And in fact, one of our interns just got a grant awarded a few weeks ago that we were really excited about. So there's lots of opportunities for research for residents that are interested in that. And then one other thing I would mention is that our Hubbard Center for Children, which is a new hospital tower that just went up a year ago in the fall, that just opened, houses a brand new PICU, NICU, CICU, really expanded educational space for our residents and students. And so we were really excited to open that as part of our new facility. In addition to those things, one of the things that we really stress in our residency program is flexibility. And so we really do try to individualize the experience that our residents have based off of where they see their career headed. And that's through a variety of different electives. We have essentially every subspecialty you can think of represented at our hospital. And so it really does provide a wide variety of experiences for our residents. I think on that next slide, you saw there's 45 residents per year. So we're or total 15 per year. So we're a medium-sized program. We have 4 Med-Peds residents per year as well. We mentioned some of the medical school affiliation stuff. About half of our residents go into fellowship. I would be remiss if I didn't mention that one of the new tracks that we are standing up is what's called our Public Health Justice track, which is an opportunity for residents who are interested in more formal advocacy and public health education and experience to get that through our College of Public Health at the University of Nebraska, and working with some of our public health faculty there, as well as in the Department of Pediatrics. And so we're really excited to stand that up for residents who want to go beyond just a traditional advocacy elective and do a little more with that during residency. And built into that is this partnership too with what's called our One World Community Health Center. It's a federally funded community health center in Omaha that a lot of our residents take advantage of for their continuity clinic, and is really a growing partnership over the last 5 to 10 years. And then I guess I would just close with, I am an Omaha lifer. I did all my training here. I'm from Omaha. And absolutely love it here. It is, I think, as many people have mentioned, such an affordable cost of living in the Midwest, so easy to get around, and just the kindest people you'll meet. So I will end it with that, but thanks for having us here tonight, and you've made the best decision going into pediatrics. So thanks.
Thank you, Dr. Goodrich. Okay, so I believe that's all of our programs. We have time for a couple of quick questions if anybody has any questions. I'm going to open the room up.
Hi, I'm Kerry Vera. I'm from Ecuador. I'm an international medical graduate. I'm interested in teaching and how the program focuses on how to teach to the residents, how they could teach, because I heard some experiences such as teaching to students, to the medical students, or maybe with with scientific topics to elementary school students. So I would like to know that. Thank you.
No, our program, we do have a residence as teachers curriculum, so you'll get to have experience, learning about how to teach. So we have a session on feedback, a session on teaching like the difficult learner, as well as like a session on different teaching styles and methods. So we don't assume that you come in, having a teaching degree. I know that most of us had just kind of modeled after people that we thought were good teachers. So we can definitely help put more tools in your toolbox as far as being confident in teaching and also like being an effective teacher in, hopefully a time efficient manner as well.
Thank you, Dr. Boyd.
We too here at Central Michigan also have a residence as teacher curriculum that was implemented this year as part of the Central Michigan University strategy for residents to be better teachers as well too. So it's just to echo, like I think in the past, we all modeled ourselves, but I think we understand that we need to actually have curriculum to help improve teaching styles for residents to be better teachers.
Yeah, we also have a resident a teacher curriculum for all of our residents, as well as a resident teacher elective that our residents can take if they want more in detail training on how to teach. And then those who are really interested in having careers as clinician educators, we have a GME-wide pathway called the Clinician Educator Training Pathway. That is a 2-year program for residents and fellows who are interested in clinical education, and they get additional training throughout that time and complete an education project as well. So it's a program that we're very proud of.
Great. Thank you, Drs. Shu and Kane. Thank you.
I'll just also add that UNMC, very similar, have resident as educators elective that we actually just started a couple years ago, and have some other curriculum built in as well. By next, I think summer, we should have this up and running. There's a program being trialed in the internal medicine department right now called the HEAL track, which is a longitudinal educators track for residents interested for those that kind of want to take it a step further. And it's been a huge success in the internal medicine department. And so the plan is that we'll be expanding it to pediatrics by next summer. And so it's going to be a 2-year program for residents that really want some more intensive education and working with learners.
Great. Thank you, Dr. Gary.
Well, we don't have a specific elective for residents as teachers. There are in our didactic sessions built in some of these various lectures that the other PDs are talking about as well for residents as teachers.
Thank you, Doctor.
Hello, can you all hear me? Okay, hi, my name is Kojo. I'm an IMG from Ghana, West Africa, and I'm connecting with you from Ohio, Columbus. So I had 3 questions. I think the first 2 are general, and the last one is specific to nationwide children. So the first question is, what's your take? Is there any like cutoff for USMLE step scores? That's the first one. And then the second one is, what's your take on a candidate who has had failed attempts at just the step 3 exam? And then the last question, which goes to nationwide children, is I just opened the website and I'm looking at the international graduates policy. And I see here that the candidate must have 1 year of postgraduate training in an accredited pediatric or IMPEDS residency training program in the United States or Canada since graduation, prior to submitting an application for residency. So please, could the faculty from Nationwide elaborate on that for me, please? Thank you. I guess my questions were all clear, or do you want me to repeat them all?
I guess I will start. So I think from the standpoint of USMLE step 1 is your first question. It is a good question. And I think, traditionally programs have used step 1, step 2 scores just to see the caliber of medical knowledge, and maybe kind of highlighting which people to interview at that point. Having said that, at least here in the United States, I know the transition for step one is to phase out the score and go to a pass-fail system for step one. And so obviously, I think we are learning to focus, so my goals when I'm focusing on the applicant is to kind of looking at your entire summary of what your clinical experiences have been. So certainly we don't have a requirement of a year of post-grad training, but certainly we would like to be able to see what your clinical experiences have been, kind of thing. But then also along that line, since we don't have that step one score, I do think that there are it is difficult, as we know that sometimes it is hard for foreign medical grads with English being a second language when it comes to passing the step one and step two scores. But we would have to look at the whole gestalt picture of the application to kind of see if at every one of these standardized tests, if there is multiple fails on everyone, then that would make the applicant, could make it be a red flag for the applicant as well too. So it's not to say I wouldn't offer an interview. If I offer a resident applicant an interview, then I am interested in that resident and potentially ranking them. So I kind of thing too. So it's just, I just need to know what I am taking on as a candidate. And then we have resources here to try to help them succeed. But it is something that we all would have to pay attention to if someone has failed multiple times. That's my opinion anyways.
Okay, thank you.
And one last thing, I apologize. So for us here in Central Michigan, we have an away rotation at the University of Michigan, and they have strict criteria as to which medical schools that you can graduate based on the state of California requirements for what medical schools they allow for licensing there. So we do have that on our website as well too.
Okay.
For our program, we really try to take a holistic approach as well. And while I don't have a specific score that we would say that you need to meet, we do want to see your general interest in pediatrics, what you've been doing. We want to see your life experiences as well, because we need to have well-rounded residents. We do take into account the failures as well, and being a smaller program, we do not typically take people at Mercy St. Vincent who have had a failed step in the past.
All right, guys, unfortunately, I have to cut off the questions because we're all moving back into the main room. But thank you so much for all of your presentations. It was amazing. I learned so much. And I really, really appreciate you guys being patient with us. This is a really awesome thing to have all these programs together and to learn all about you guys, especially for people who have never been to the Midwest or don't know much about it. So we really appreciate it. Thank you so much. Okay. Great. Okay. I believe you can hit leave room and it'll take you back to the main spot.
But thank you and welcome to room 4. I think this is the nicest room, but don't tell the others I said that. So my name is Chamaka Wachuku. I'm one of the co-directors for FuturePedsRes, and I will be your moderator for room 4 tonight. We have amazing programs here this evening, and then we're going to hear from all of these programs, and then we're going to take questions at the end. I'd like to please remind our program representatives that each program has 5 minutes to present. Let's try to keep within that time as we have quite a long list to get through tonight, but we'll try to make sure that we keep the chat very engaging, and then participants, you can please ask questions in the chat, and any questions that we are not able to take while speaking, we can also take them in the chat. So I hope you're as excited as I am to invite our first program for tonight, which is the University of Michigan.
Good evening, everybody. I'm Heather Burrows. My pronouns are she and her. I'm the program director here at the University of Michigan. And I agree that this region is the best and this room is the best. So you guys all were lucky that way. One of the things that we like to highlight about the University of Michigan is that we really have a little bit of something for everybody. So we're a large academic center that really tries to provide a curriculum that is the right for every resident. So we have folks who go on into primary care like myself, and then people who go on into every single subspecialty out there, including going into combined psychiatry programs. So really anything that you could possibly do after pediatric residency, we've had alums who are doing that. One of the things that allows us to do that is being at this large academic center where we have people who can work with individuals outside of pediatrics in all the other specialties of medicine, as well as take advantage of the wonderful University of Michigan. So the School of Public Health and our engineering school, the business school, really there's opportunities for you to interact with individuals in those areas in scholarly work and other educational experiences. We really value the input of our residents and are always trying to make changes to our curriculum and adding really wonderful electives that residents suggest to us. We have some really nice opportunities for residents to get involved in activities across the University of Michigan. So there's a program for individuals who are interested in medical education. There's a program for individuals who are interested in health equity research and opportunities to be involved in our quality council for house officers across the medical center. We are one of the places in the country where our house officers are unionized, and that provides a lot of leadership opportunities for our residents as well. We get to see patients from all over. So, people drive 14 hours to see us from the Upper Peninsula. They fly from all over to come see us. And I think that really provides a broad exposure to every type of pediatric issue that you could possibly come up with. Wellness is something that matters a lot to us and really providing support for our residents. We have these wonderful people called resident assistants, so an administrative assistant on each of our inpatient services that helps take care of things like prior authorizations and calling to get records from another hospital and setting up the sedated MRI with the LP and all of those things that can take away from patient care, but are really important to do. They also are great sources of candy in the team rooms on a regular basis, which is quite lovely. I think the other thing that's wonderful about the University of Michigan is Ann Arbor, the town that we live in. It's uniformly considered a really wonderful city to live in, gets voted one of the top places to live in the country. Everything that you could possibly want to do is here, from outdoor activities to wonderful restaurants to sporting events, really right here in our town. And then if you want to go a little farther away, you can go to Detroit. It's about a 45-minute drive from here to see, bigger sporting events even, or take a train to Chicago. Pretty soon there's going to be a train to go up to the Upper Peninsula, or to the upper part of Michigan, so you can go to the vineyards and all of those things. So really all those opportunities are available for people to enjoy while they're spending their time here. And I'll stop there because you can read the infographic, but I'll be eager to answer other questions that people have later on.
Thank you so much, Dr. Burrows, and thank you for, keeping it very short, very sweet though.
Nicole is one of our residents and she's awesome. And she gave me strict instructions to not cause problems for you guys. So I'm following those instructions.
Thank you so much. We're really glad to have you here. So now we'll be going to the next program. I just want to remind all participants that you can put questions in the chat, and then we're going to take them all at the end. And then program representatives, I welcome you to also respond to whatever questions people have in the chat as well. So our next program for tonight is the University of Wisconsin.
Hi, I'm Dan Sklansky. I'm the program director in Madison at the University of Wisconsin, and want to again thank you for all being here and say that it is a pleasure to be here talking with you and starting this cycle anew. So it is hard to follow Heather, I have to say, since we have many similar talking points. She's more eloquent than I am, but I also will not dwell too much on the individual numbers of beds and admissions and all those things that you can read here or on our website or other publicly available spots. And I think I really want to focus on our culture and then a couple other unique features. So the culture that I want to highlight is our motto of being driven and supported. And I think that, it's important that you be driven to be the best pediatrician you can be by the end of residency, and that you have that as a lifelong goal as a learner, advocate, coach, mentor, and caregiver. And we are driven to have the best residency program that we can provide for you. So I think that means listening to a lot of feedback from learners and from people who are on the front lines, having faculty who are highly invested in being at the bedside and having open doors and having little face sheets of all the residents up, and really maintaining that degree of connection. And that that goes into the support that we give. So, in addition to the clinical training that you'll get here, that's excellent and is a quaternary care center and sees everything from, I don't know, around the state and also flown in from around the country for some things. You also get a lot of support in learning advocacy, research, quality improvement, and staying well as a resident and the physician throughout your career. And we have professional development for all of those areas. I think that also in terms of support, just that family feel and easy connection among faculty and residents, and the first name basis and the ability of faculty to often know something about where you're from, your family, spouse, dog, whatever it may be, if you have those, that really contributes to that family feel and flattened hierarchy here. Despite being, I don't know, such a friendly, family-centered place, we're also a huge research university. And I mean, the greater University of Wisconsin offers a lot of resources for anything you're interested in. But just within the Department of Pediatrics, we're number 7 in the country for NIH funding. So I think that you can come here and get amazing general pediatrics training and have a one-on-one mentor for all 3 years in your continuity clinic who becomes your lifelong friend and mentor. And about half of our residents do go into primary care. The other half go into fellowship. And a lot of them really make use of those connections and skill building that are here through those connections with the NIH and other sources of research funding. I also want to talk about the individualized journey and how we're able to provide that. So the ACGME mandates that programs all give residents 6 blocks of individualized learning. Programs do that in all different ways. And I just want to say that I think we really follow the spirit of that law, not just the letter of it. So if you follow the letter of it, that just means that residents have a choice in what order they do certain things. They may not have 6 electives to do literally anything they want towards their education. But you really do get that here. So we will help you make electives. We also have a large bank of electives from which to choose. You also get a lot of individualized mentorship, again, through choosing that continuity clinic mentor, research mentor, and then finding other people who can really be good coaches and mentors throughout residency. And then parallel to Heather's structure, I want to mention another the last big selling point, which is the city of Madison itself. And it's a city with a population of about 250,000, and including the suburbs, now close to 500,000. Still has a college town feel, yet is also the capital of Wisconsin, and gives you an opportunity for advocacy, same Big Ten sports teams, a lot of theater, a lot of restaurants, most per capita in the Midwest, allegedly, and is actually the #1 most livable city in the country for 2 years in a row. So you can do everything here and get amazing training here, and welcome any questions and for you to all apply. Thanks for the time.
I'm sorry, I seem to be having trouble unmuting myself. Thank you so much, Dr. Clancy. And we have such amazing representatives tonight. Everyone's keeping to time. I love that. Thank you. So now we'll go on to the next program for this evening, which is Rush University Medical Center.
Hi, everybody. I'm Bridget Boyd. I'm the program director at Rush. So great to see everybody. This is just so great how it's so smoothly running. It keeps getting better and better each year. It's great to be a part of it. So Rush is in Chicago, and we are a medium-sized program, 11 peds residents, 4 med peds residents. We are located on the west side of the city. So it's a very urban population. But as you'll find in Chicago and probably in other cities too, people are very institutionally loyal. So maybe someone's like great grandma had a bypass at Rush, and so then their grandbaby is going to have their peds at Rush. So people come from all over the city and even from nearby states. Sometimes it's kind of amazing where everyone comes from. But our main population is a very urban population, all of our residents have their continuity clinic right across the street from our hospital. So we're a children's hospital within a larger hospital, and then our clinic is right across the street. It's a really big, amazing clinic. It's why I came to Rush 20 years ago. And it's an amazing place for residents to learn and to spend time. They have their continuity clinic there, and as well as their acute care rotation there. One of the things we're really super excited about this year is we just switched to the X+Y scheduling, and we did that for a couple of reasons, mainly wellness reasons. But one of the reasons was to really maximize that time in our clinic, because residents would be running back and forth and stressed, and they'd be there and they'd be getting calls from the floor and all those kinds of things. And so they can really maximize that week that they have. When they're in our clinic, they're seeing patients. They also each have longitudinal experiences now during their Y weeks, which is so cool. That was something I didn't really fully appreciate until we started it. So the interns have advocacy now during their Y weeks spread throughout the year. Our second years have a mental and behavioral health rotation, which we always had, but now it's spread throughout the year. So they can see a patient with depression and then follow them once a month throughout the year, which I think is going to be really awesome. And then our third years have their med ed time during their Y week. So far the residents love it. And I think it's just going to be a great thing for our program. So that's something we're really excited about. Our department is very resident focused. We don't have any fellowships, which I think is really kind of cool. I came from a program where there were a lot of fellowships. And what I see at Rush is that the residents really have a lot of autonomy. And that's what I hear when they leave and they start fellowships as well, is they really feel like they got to manage the patients. They got to make all the decisions at night. We don't have in-house hospitalists. In the PICU, we don't have fellows. So I left today and there was a super sick kid that they were putting ECMO orders in on, and our residents are the ones that are doing it. So that part I think is really great, both for developing that confidence, but also really choosing a fellowship and choosing what you want to do, having kind of that real world experience. So our residents go into fellowships, they go into primary care, some in the city, some in the suburbs, some in different states, and they go into hospitalist jobs. So really anything. I just did a slew of letters of rec, like a lot of the other people on this call, and it was for genetics and PEM and cards and NICU and all sorts of things, which is really great. DEI is a big focus for us. We have goals and objectives that we've added to each rotation that are DEI based. And we have a retreat every year for a whole department where we close down all the clinics for a half a day and everyone comes together. We have restorative justice circles that we've added into orientation and into our retreats for the residents. And that's actually what we're focusing our retreat on this year, is we're going to start those restorative justice circles with the faculty, who I think often need the DEI work more than the residents. So I'm going to stop there and I'm happy to answer questions later on.
Thank you so much, Dr. Watt. And thank you for talking about your amazing program. I have like a notepad beside me because I'm putting down notes of all the programs I want to apply to after this webinar. So thank you, everyone. Thank you so much. So now we'll move on to the next program for this evening, which is Marshfield Children's Hospital.
Hi, everybody. I'm Suzanne Wright. I'm the program director at Marshfield Children's. Welcome. I want to introduce my team as well. Uzo, I think, is on with us if you want to say hi. And I think one of our chief residents is on, Diana Montez. So if you guys want to say hi, go ahead now.
Hi, everyone. It's great to be back here doing this. It's our third year in a row, and it's been so much fun doing it. So thank you.
Hey, everyone. Welcome. So I'll just tell you a few things about our program. Very similar to what you just heard from Rush, except that, so we're a small program. We do not have fellows. I think that is a strength, but different than Rush in the sense that we are in a more rural, semi-rural community. So if being in a small town and small community appeals to you, definitely apply to our program. We have a lot of residents from all over the world, from all over the United States, and that's really been an exciting and fun journey for me as a program director, getting to know all of the different residents that have come through our program and watching them grow and supporting their growth. Our residents go into primary care and fellowship about half and half, and we try to support their journey so that they're prepared for whatever they want to do in the future. We have a very supportive, collegial, team-focused environment. This is a team sport. We're all in this together, and we all need to bring each other up, and we all need to do our best for kids. So it's really been a fun experience being in Marshfield, and I I love the fact that we have one-on-one teaching and coaching for our residents. We have a lot of support. We have a resident wellbeing committee that's very helpful for residents that need some confidential support. So that's been a really nice thing to add. We have all of the other things that most programs offer in terms of, research, ICU care, primary care, continuity clinic, all of the different things that you're expecting out of a program. It's just in an environment that's a small town where it's very comfortable to live here, inexpensive, low crime, low stress. And so in that sense, I feel like you have a very supportive place to live while you're learning to be an expert in kids. I'll give Uzo a few minutes to say something about the program as well.
Yeah, so I'd have to tell you, my favorite thing about being in Marshall and our program particularly is the mentorship. I cannot say enough about that. You have a really committed faculty who are there for you. If you have an idea of what you want to do, fantastic. If you're not so sure, it's probably a more exciting but equally rewarding journey for us as we discover what you want to do. So if you think, feel, or know you can make a difference caring for children, we would love to have you. Check out our websites and social media pages, and we'll look forward to this interview season. Thank you.
Thank you so much. So many amazing programs to choose from. Now it's getting more difficult to decide which to apply to. Thank you so much. We'll now move on to the next program for the evening, which is Southern Illinois University School of Medicine.
Thank you. So I am Kate Siebenaller. I am the program director for SIU School of Medicine, and we're really excited to be here. This is the first year I think that we have done this, so thank you, and we're really excited to be part of this group this year. So it's really exciting to see all the different applicants who are on this, and welcome. We are located in Springfield, Illinois, so we are also consider ourselves a small city, semi-urban. We're not completely small town, but we're definitely not a big city. And we're located pretty much in the center of Illinois, about an hour from St. Louis and maybe 3 hours from Chicago. So that's kind of where we're at. And we are the capital of Illinois, so we're a capital city too. The things that we really love and highlight about our program is we're a really close-knit group. We've got an amazing group of faculty that come from all over the world and all over the country. And then we have an amazing group of residents. But we have way more faculty than we have residents. So that allows us to have a very individualized, close relationship with our residents. And they get multiple mentors, advisors, research mentors throughout the way to really help them be successful and figure out what it is that they want to do and where they want to excel. Even though we are in a smaller city, we're still a pretty big catchment area in terms of the patients that we see and the pathology that we see. We're pretty much the only children's hospital between St. Louis and then if you go up to Peoria. So we've got a pretty big area that we serve, and we serve a lot of Southern Illinois for patients who may not want to go to the bigger city of St. Louis. So we have a pretty busy inpatient service. We have a very busy PICU. We're a level 1 trauma center. We see lots of pediatric traumas, and we have a really good mix of primary care as well as all the subspecialties. And we have all the subspecialties here within our hospital with the exception of rheumatology, and we have close relationships with the group out of St. Louis. If anyone wants to go explore that a little bit more down there, we make that possible. So with all of those different services, faculty, and then only 8 residents per year, we do a lot of individualized coaching and mentorship, which we really love, and the residents seem to really benefit from. We've had some amazing national recognition for their work, both at PIS with platform presentations and awards at an ED conference for one of our residents last year. So we're really proud of what our residents do. In addition, the other things that we focus on, we really believe that if we're standing still, we're going backwards. We're always trying to change, look into what's new, and focus on our quality improvement. So we have a longitudinal quality improvement curriculum that the residents go through where they both learn QI and then they apply the QI concepts to projects to help improve the way that they learn in the program. So with that, we've had a lot of really cool innovation that have been all resident driven with the support of the faculty to kind of help move us forward. And so we've really loved that. A few other things that we wanted to highlight is a few things with our diversity initiatives. Everyone has mentorship within that area. And then we also have at the School of Medicine within SIU, we are an anti-racist university and institution. And with that, we offer a lot of coaching, mentorship workshops. We have a microaggression workshop we're doing this year to try and help catch those and interrupt those when they're happening. So we're excited about all of that. So like everyone else, I don't want to drag it out too long, but we're really excited to meet you. We welcome any questions that you may have along the way. And I'm excited to see some of you on the application trail this year.
Thank you so much. And I want to remind participants that you can put your questions in the chat as we're going to our last program for the evening, which is the University of Minnesota.
Hi again, everybody. Again, I'm Johanna Scheuer, one of the Associate Program Directors, and there are pictures of our Program Director, Emily, and Program Coordinator, Amy. We are really proud of our big residency leadership team that we have. And I'll introduce you in a couple moments to two of our chief residents too, who are part of our leadership team. The University of Minnesota program is a bit different from the last couple programs highlighted in that we are a larger program with 26 residents per class, and we have 10 med-peds residents per class, and we are a multi-site training program. And for someone looking to really be able to see multiple practice settings within residency, Emily likes to say it's not the place where if you want to park in the same parking spot and get your same breakfast every morning, but it is the place if you want to see quaternary specialty care, a more community site, our county hospital site, level 1 trauma. People don't go back and forth to all our sites in one day. You go to different sites on a per rotation basis, and throughout all 3 years get a lot of exposure across our multiple sites. We have a very long-standing and strong global health program with a certificate in global health available. A lot of, in a big university setting, a ton of different research opportunities, as well as a lot of community engagement, both through the university and just out in the community. All that being said, being a larger program and having multiple sites, we have the same curriculum that every program kind of has to have. And then we also put a lot of emphasis on helping everyone become the pediatrician they want to be, and able to match into subspecialty training, practice, and what kind of general pediatrics they want to do. And so we do put a lot of emphasis on lots of elective options, and our mentorship with the associate program directors. And I see myself as a matchmaker for my advisees, helping them find more specific mentors in the areas they're interested in. We're also proud of our longstanding academic half-day program. And then probably one of the final things I will mention is we love the Twin Cities. It's a large urban area, over 1 million people in the Twin Cities of Minneapolis and St. Paul, and we've got everything you want to do, from outdoors to theater, most per capita theater seats outside of New York City, if you can believe that. Restaurants, lots of sports teams, a whole bunch of things. I think those are the highlights I wanted to share, and then I'd love to invite Dr. Bonnie Benson, one of our current chief residents, to chime in with things she wants to make sure we highlight.
Yeah, hi everybody. It's so exciting to be here. It's obviously my first time being here. I think in addition to everything that Dr. Scheuer was saying, I think our multi-site model is definitely something worth noting because I think it's really different and special, both because it lets you see a diverse patient population, but it also lets you see a diverse approach to taking care of patients differently at different places. And then I would say that in general, I think that our program really works hard at supporting residents, and that's a really big part of what I do, is supporting residents both in their academic pursuits, but then also their life outside the hospital. That's something that's really important to us, which I think is highlighted really well by our flexible PTO policy, where you can take PTO not in week chunks, you can take them in days on PTO eligible rotations. And I think we have like lots of wellness initiatives that I'm happy about to talk about later. I don't want to get into all the details, but I think we really value people's time and lives outside the hospital as well. And I think that that's an important part of being a pediatrician too. So I think that we put a big emphasis on that.
Great. Thank you so much. And thank you to all our program directors, residents, and representatives that have joined us tonight. We have about 5 minutes left. I want to say well done to everyone who joined. We were right on time. We did it properly, and we said all the things that we needed to say, and we still kept the time. So yay to everyone for that. We did amazing on that. So we have a question, and I'm just going to throw this open to any of the program representatives that wants to answer. So the question is from Martina, and she says, what advice would you give to applicants on navigating the new supplemental ERAS process? So anyone's welcome to answer.
I mean, I think Dr. Bauer's answer is exactly right. We don't know either because it's the first time we're doing it. So we're all learning on this together. Everyone that I've talked to has agreed that we're really going to continue to do the holistic reviews that we've all been spending a lot of time fine tuning over the last couple of years, and really thinking about it as truly supplementary. So, you know, maybe as a way to help us identify the top things we want to highlight to the people who are going to interview you or something like that. But I think it's not something that I would recommend spending hours and hours stressing about, because we don't know what to do with it either. But hopefully this will be something that will be helpful to everybody.
Thank you so much. So if there are any other questions in the chat, if there are any other questions, you can just put them in the chat.
I just wanted to say something about the supplemental application. This is Suzanne from Mayo Clinic. I just want to encourage you guys to do it, because we are going to try to use it, and we definitely want you to try to fill it out. But it's just really for the initial screening process to try to figure out who to interview, because so many people are applying so broadly, it can really be hard to know who to interview. So we really want to interview the people who really want to come here. And so we really want to open that door for you. And so I would say fill it out, because I think it will help open your doors.
Thank you. So there's another question, and this is from Chad, and he says, thanks to all the program directors, what percentage of residents in your programs are IMGs, and do your programs have a limit on years of graduation?
Hi, so I'm one of the chief residents at SIU School of Medicine in Springfield. We actually have a large percentage of IMGs. I would say close to 50% of our program is probably IMGs. I know in my class, 50% of us are IMGs. I'm an American medical school graduate, but most of my class is IMGs. I'm not sure if I don't think we have a limit on years of graduation, but I would pass that. My program director shaking her head no. So we do not have a limit on years of graduation.
We really look at the person, and we're not screening necessarily if you're IMG or not. It varies year to year. And we, again, do the holistic approach to who's applying, and we get to know you on your interview and just make sure you're a fit with our group. And that's kind of what we're looking for.
I think you're probably going to find that programs can't really have a limit, because, you know, whoever we get in the match, we get in the match. And so, you know, it would be quite difficult to, you know, in our rank list, try to predict an exact number of any one type of person, whether that's from within our region or outside of our region, or men or women, or I don't know. I think that, I mean, I am only speaking for our program, but we are trying to be diverse in all ways. And that means within the country, globally, and then getting residents from all different backgrounds. And, you know, that certainly has focused on URM status in the past, but I think we are thinking very broadly and still, I think, maybe first on URM status, but also geographically, nationally and worldwide, also including type of training, whether that's traditional MD, DO, or things before med school. So, I mean, speaking for our program, I think maybe like 5 to 10% are internationally trained, but we don't have a set number. We're just looking for really good people who have a lot to bring.
Thank you so much. So there's one question that we collected earlier, and I would just like to ask that. So how do your programs handle feedback? So what's the process like for feedback from residents about, you know, systems, about, you know, members of faculty, about challenges they're having in the workplace? So what's the feedback, and how does your program handle that sort of feedback?
I can talk about ours for a second, and it's probably similar in other programs too. There's lots of different ways that we get feedback. So I have residents just walk in my office pretty frequently and say, hey, can I talk to you about something that just happened or that happened last week? Or they go to the chief residents and tell them, and then they come to me. We also have formal, we use MedHub as one of the systems that a lot of programs use. And at the end of each rotation, the residents fill that out, and then we get that feedback back about those rotations, and we look at that kind of in chunks throughout the year. Also, the faculty get feedback that's kept anonymous, and we give that to them once a year, so they can't tell which resident it came from. But that's another way that feedback is given. We have house staff meetings once a month, and we always set aside some time at the end of the meeting where we say, all right, what's going on? What are the challenges right now? What are the areas we need to work on? So lots of different ways. I think it's something that we talk about a lot. Or what are the problem areas? What are the things that we could be doing better? And try to just keep improving wherever we can.
One thing that we do in our program too is a lot of coaching to both our faculty and our residents about a growth mindset, and that we're not here to give you feedback to evaluate you as good or bad or superior like you usually get in medical school, all these terms that are given to you in your dean's letter. This is about where are you now and where do you want to be when you graduate, and what kind of pediatrician are you want to be and where do you want to improve, and helping residents grow in that area and really focus on, oh, is there an opportunity to get better at this one thing? Let's work on that. And that's one way we give feedback in lots of ways, similar to it, what's been mentioned already, but that's one thing that we try and focus on.
Thank you so much. And I have one last question. And the question is, so tell us about your plans for the future. What is the next big thing for your program? What are you looking forward to? What's happening next that you think participants are going to be interested in? This is open, but anyone can answer if you have any.
Yeah, I can share something I'm really excited about. We've had a long-standing academic half-day program for, I think we're one of the earlier programs to adopt that model. And it's been every other week for about 10 years now. And we are excited that we are doing it more on an academic calendar. So kind of during the school year, we'll actually have it every week. And we're excited to be expanding on this protected time for all residents, one afternoon a week during the school year, and expanding on what we're able to do in terms of some simulation workshops, longitudinal work on QI projects during that protected time. And yeah, really excited to see how that goes this year.
Thank you. Does any other program representative want to tell us about what's next for them? Okay, that's fine. I think there'll be like a bunch of other opportunities to have a chat about that. So we will be heading back to our main room very soon. I see a program saying that they have pizza with the program, which is great. Let me see, what program is that? Ah, Wisconsin, great. Expect my application, please. Okay, so we're going to be heading back to the main room very soon, and then we're going to have the residents after hours. So I want to thank everyone for joining in tonight. It's been such an interesting and enlightening session. I do hope that all the participants have been able to make more informed decisions about the programs that they are going to be applying to, or that they have already started to apply to. And then for all the program representatives, if you're comfortable, you can leave your email or contact information in the chat box so that people can reach out to you in case they need more information. Also, on the FuturePedsRes calendar, it's open for programs to add in when they're having their virtual cafes, meet and greet. So you can just put in on the FuturePedsRes calendar, and then applicants, you can look at the FuturePedsRes calendar to also know when some of these events are coming up. So thank you so much, everyone. We'll be heading back to the main room shortly, and have a great rest of your evening.
Good evening, everyone. Once again, my name is Glory Ayonda. I am a recent medical graduate from Windsor University School of Medicine in St. Kitts, and I serve on the FuturePedsRes Webinars team. All right, so welcome to Breakout Room 5. And just a quick roll call to make sure that we have every program in this room. So I'm going to call the name of your program. Please, if you're a representative, just unmute your mic and let me know you're here, okay? University of Missouri.
Good evening, we're here.
All right, great. UNMC Children's Hospital of Pittsburgh.
Hi, I'm one of the chief residents, but my PD, Kate Watson, I don't believe is in this group yet. She's on the other meeting though.
Okay, great. Advocate Christ Medical Center. No, okay. University of Iowa Stead Family Children's Hospital.
We're here.
Okay, great. University of Oklahoma Health Sciences Center.
We're here.
Perfect. All right, thank you so much. All right, as we mentioned in the main session, every program has 5 minutes, and I apologize in advance if I have to stop you at the 5 minutes mark. I am so sorry, but yes, and also up to applicants, students in the session, if you have any questions, please feel free to ask in the chat, and also program representatives, feel free to answer questions to the best of your ability. All right, any questions? All right, great. So we are good to go. We'll start with University of Missouri.
Hi, good evening, everyone. I'm Anish Tosh. I'm the program director at the University of Missouri, and I'm joined by Dr. Varun Manohara, one of our third-year chief residents, and I'm going to have him highlight one of the areas he's really focused on, which is our food bank drive. Columbia, Missouri, for those who aren't familiar, is right in the middle of the state of Missouri. We're halfway between St. Louis and Kansas City. It is now home to me. I've lived here more than anyone else in my life, and I love it here. A town of about 120,000. We have fantastic parks and rec here. That's usually where I see my residents on their free time. A great dog park. So we have a lot of fur babies in our residency program, and great to see our residents hang out with their puppies. We have a couple of nice tracks that are new to us. We have an MS Health Informatics resident scholar position, which is new. So you can obtain a master's in health informatics in addition to completing your residency training. And we also have an advocacy track, so you can get special training in advocacy, which is our calling in pediatrics, in my opinion. We offer a second continuity clinic experience in your second and third year. If you're interested, you can get some additional training in another field besides your general pediatric continuity clinic. And Columbia, Missouri is half an hour away from our state capital, which is Jefferson City, Missouri. And so we have a lot of legislative advocacy as well. If you're interested, we meet with our legislators at least once a year for Advocacy Day. And it's been a great opportunity for us to advocate at the state level. I mentioned Varun, he's our chief resident. I'm going to hand things over to him. It looks like we still have a few minutes left in our time. Because one thing I'm very proud of is the resident-driven initiatives that we have. And one of those things I'm very proud of is our food bank drive. And Varun is actually very involved with that. So I'm going to hand things over briefly to Varun to tell you more about our food bank drive.
Hi, everyone. As Dr. Tosh mentioned, I'm Varun, one of the chief residents. I'm a third year. I'm applying for fellowship in child abuse, and I've been at Mizzou for a long time. I went to Mizzou for medical school, and I chose to stay here because I really enjoy the small program and being able to know your attendings. And one of the things I'll talk about real briefly is it's not really a food bank drive as much as a fundraiser. We try to help our Missouri Food Bank by helping fund their increased purchasing power for things like a buddy pack, food for kids with food insecurity at home. And so it's a great opportunity that started out almost 10 years ago. We'll be starting doing our 10th year. It started just in our child pediatric department, and now we have a lot of different departments involved. We are able to compete against each other. And it's just one example of, like Dr. Tosh had mentioned, advocacy. You don't necessarily have to be on the advocacy track to do a lot of advocacy in our program. I feel like it's a great example of there's a lot of flexibility to decide what you want to do. You just have to find what you're interested in, and you're able to go ahead and do that. And I've been lucky enough to head the food drive the last couple of years, and Mizzou's a great place to get your training. So we're really proud of the drive and the program, and would love to talk more about it.
Hi, good morning, good afternoon, good evening, depending on where you are joining us from. My name is Kate Watson, and I'm one of the co-program directors of the Children's Hospital of Pittsburgh Pediatric Residency Program. We are a freestanding quaternary care center that has a huge volume and variety of patients. We serve a primarily urban patient population, but we are very fortunate in Pittsburgh to be paired with many community clinics in the greater Pittsburgh area. So we also offer opportunities not only in urban underserved patient populations, but also in suburban and more rural patient populations. One of our really flagship programs to welcome our residents and make them feel a part of the Pittsburgh community is our Bridges Mentoring Program. It's a mentoring program that begins before you actually start your pediatric residency in Pittsburgh, and it seeks to pair matched residents with faculty members that share similar interests, similar research interests, or similar career interests. And it's really based on the applicant or resident's interest profile. So it's a wonderful program that then transcends the 3 to 5 year training program in Pittsburgh. Although we are a quaternary care center, we have a primary care and foundational focus. Really, we seek to train the most outstanding pediatricians that can go on to any career path. About 2/3 of our residents go on to fellowship training, many of them training at some of the most outstanding pediatric fellowships across the country, including our own here in Pittsburgh. We have a research rotation to really get folks started off on their research career in intern year. And that could be translational research, clinical research, advocacy research. This is a project really that is focused on your interests, and we create the space and the time and the mentorship to allow you to continue to pursue those passions throughout your residency training program. We are a program that truly believes that the diversity around the table makes us a stronger program. And so that's not only diversity in the residents that train with us, but it's also the diversity of programs that train within the Children's Hospital of Pittsburgh. We have 8 tracks in our residency training program: a categorical pediatrics track, a medicine pediatrics track, a pediatric scientist development track, pediatric anesthesia track, a triple board track, which is pediatrics, child and adolescent psychiatry, and psychiatry, a child neuro track, and a neurodevelopmental disabilities track. We have special interests that include PRIME, which is for our pediatric residents interested in medical education, ROAR, which is a research-focused primary care interest group, and wellness, diversity, and inclusion are large resident-run interest groups. This year, we are really excited to start new curriculum in the leadership pathway. We've launched a leadership training curriculum because we believe and know that every single pediatric resident is going to be a leader in their career. And so we start off with a leadership training series, an intern year focused on leading self, then leading a team, and then leading within an institution. We also focus on simulation curriculum for procedures, for difficult conversations, and for mock codes. We have specialized training that begins in PGY1 around social determinants of health and community engaged pediatric care. And so we are really passionate about training you to be the most outstanding pediatrician that you can be, and have many different paths, options, and highlights to be able to get you to that end goal. Pittsburgh is an amazing city where we have, as you heard earlier, 4 seasons and 4 seasons of fantastic activities that you can do inside and outside. It is a city that is affordable to live in, and many of our residents purchase homes, which is also an exciting next track for our residents. We are passionate about sports in Pittsburgh, but you don't have to be passionate about sports if you want to come and train in Pittsburgh, because we have a really exciting cultural scene also. It has become a foodie haven, as many cities in the Midwest have, for microbrews and amazing food. Pittsburgh is also a green city in that we have bikeability, and you're able to get around the city in bike lanes and hike, bike, run in our beautiful city park. So we are really proud of the city that we work and serve in, because we seek to serve a patient population that has been historically marginalized in our city, and really provide care that is critically necessary, as many of these children's hospitals do. So thanks for allowing us to come today, talk about Children's Hospital of Pittsburgh and all the amazing activities that we have to offer in Pittsburgh, Pennsylvania.
We have Advocates Children's Hospital Oakland program representative here. Okay, we'll come back.
All right. Hi, everyone. My name is Erin Howe, and I'm an Associate Program Director for the Residency Program here at the University of Iowa, Stead Family Children's Hospital in Iowa City. Dr. Amy Steer is our awesome Program Director and is unable to make it tonight, but she sends her hello. I'm happy to share some of the highlights of our program with you. Our freestanding children's hospital was completed in 2017, and it's home to the Iowa Wave, a tradition you may have heard about in the news when the Iowa Hawkeye football fans and players take a moment during each game in the stadium that's right across the street from our children's hospital to turn and wave at children admitted to the hospital and their families. We also have an innovative curriculum that melds together some multidisciplinary academic half days integrated with noontime conference series. And we love that our residents continue to foster a sense of community that is inclusive and collaborative. Our residents rotate through 13 4-week blocks during their academic year. And the inpatient experience includes working with both hospitalist services as well as subspecialty focused services like nephrology, endocrinology, gastroenterology. There's a wide range of pediatric subspecialty electives to choose from, as well as the opportunity to customize your special electives throughout the 3 years. During the second year, residents work with the program leaders and mentors to design a career elective where they can learn more about their specific area of interest in pediatrics. Another example of the customizable electives is a teaching elective for residents who are interested in kind of refining their medical education skills during their second and or third year residency. Also, recognizing the value of parenting experience in pediatrics, we have a 4-week paternity and maternity elective for residents who decide to expand their families during their training, and that's a pretty popular one as well. Each class has 15 categorical peds residents, as well as 2 child neuro residents. And about half of our graduates go on to pursue fellowship, while the other half go on to practice general pediatrics in both rural and urban areas. And here at Iowa, we have 10 subspecialty fellowship programs as well. And so we're always really thrilled when residents decide to stay and train, but many of our trainees go on to fellowship programs all over the US. We have 2 pathways for residents who are interested in pursuing more research, and that includes a PSCP or Physician Scientist Training Program, as well as the STAR program, known as the Stimulating Access to Research and Residency Program. Both of them incorporate additional months during your residency to kind of dedicate some time to pursuing research and working with mentors in that area. And so we're located in Iowa City, which is a Big Ten college campus town. It offers a touch of kind of that metropolitan feel downtown with lots of great restaurants and shops and festivals and shows, but still has an amazingly easy commute, lots of biking and walking opportunities to and from work, and an affordable cost of living like a lot of the other programs I've mentioned in the Midwest region. We're a tertiary referral center for patients from all across Iowa, as well as some of our surrounding Midwestern states, and residents benefit from training in our level 4 NICU. Finally, our residency leadership team has been committed to and involved with diversity initiatives at our institution. And our program leaders, as well as many of our residents, are active in diversity initiatives, including the Diversity, Equity, and Inclusion Committee here at our Children's Hospital. And one example of our efforts to expand education in DEI is the LGBTQ+ health curriculum that's in our adolescent medicine and endocrinology rotations. I think that's all I have, unless any of my other friends on the line from Iowa have anything else to say. I look forward to seeing many of you on the interview trail.
Hi, everybody. I'm Monique Nafee. I'm the program director at the University of Oklahoma Health Sciences Center in Oklahoma City. We boast the only freestanding children's hospital in the state of Oklahoma, and we are located right smack dab in the middle of the state. We are just probably about a half a mile from the state capitol and boast the full range of pediatric medical and surgical subspecialties. We're also a level 1 trauma center with a level 4 NICU and a relatively large PICU. And actually the 55 beds includes PICU and CVICU. We have lots of options for continuity clinics. And as you might imagine, we see a very diverse range of patients because we really draw patients who require multidisciplinary care from across the state. We are so lucky to have adopted the X+Y curriculum 2 years ago now, and do have options for significant individualized curricula in areas of global health, advocacy, research, med ed. We have some unique electives, including a new parent elective. We have a coaching program, which we are extremely proud of. So each resident gets a coach as an intern, and that person does not use their observations to evaluate the resident, but rather just provides formative feedback and support. And we do have a big focus on resident well-being. Fun. I'm a partner here.
I'm Dave. I'm a and one of the associate program, and I'll add, as Oklahoman, I moved here 3 years ago. I'm just so impressed with what a wonderful city it is and what a wonderful program this is. I think it's just a fantastic place to get a really good medical education and further your training. Which is such a diverse set of patients that we see. We're a big hospital that does all the cool things, ECMO, transplants. You get to see everything, but you get to take care of folks from all across the state and in lots of different environments, folks that have to travel long distances to the hospital, folks that are going back to really resource poor locations. And so from a training standpoint, you get to see a huge diversity of patients, diversity of conditions. And, we really do our best to support you during that journey.
We like to say that we are a medium-sized program, but we feel real small because it all feels like family in Oklahoma City. Karen or Christina, do you guys want to add anything at this point?
I'll say that I'm Karen Zatursky. I'm the program coordinator. I'm actually not from Oklahoma. I am from Canada, and I've been here now for 17 years or so. But it is definitely has grown on me tremendously, and it's a wonderful place to live. Lots of things to do. When I first came, it was not the case, but lots of things to do. It's definitely for foodies. We've got some great restaurants. And anyways, but that's all I wanted to say, really. But it is really a gem of a place.
Thank you. So we are quickly going to go back to Advocate Children's Hospital. No one is here. All right. Okay, then. All right. So we're going to move on then if there is no representative for Advocate Children's Hospital, Oakland. Okay. All right, so does anyone have any questions? Students or applicants? Does anyone have any question for any of the programs? Now will be the best time for you to ask. All right, if there are no questions, I do have...
Hi, sorry to interrupt. I have a question. It is to the UPMC program director. According to you, what makes the better, what is the difference between a better resident and a normal resident? Like the best resident and normal resident, according to you?
That's a great question that I think any of the program directors or APDs on the call could answer and may give you different answers. I think in our program, an outstanding resident is a collaborative resident. We work on teams, and as pediatricians, we have to be able to collaborate with an interdisciplinary team and communicate well and clearly. So not only do you have to have superb medical knowledge, but you really have to be a collaborative learner who thrives in our hospital in a higher volume environment and is open and excited about learning.
That's really good to know. And if they have time, I have another question. How much importance do you give for the research in a candidate's CV?
For our program specifically, we love to see that you've participated in research and work broadly, and that you can talk about that with passion and impact in whatever area that may be, whether that may be clinical research, advocacy work, volunteer work. I think the most important thing is that you've been engaged in projects that you feel make a difference and can think about how that may translate. I'm happy to turn it over to other programs to reflect on how important research is in your program.
Thank you so much, Ms. Watson.
And I can take a stab at that too. I think that's a great question. So I'm Lindsay Harshman. I'm one of the APDs at the University of Iowa, and clearly enjoying the great outdoors this evening on my deck. Another benefit of the Midwest. But I do the research component of our residency program and direct the physician scientist training pathway and so forth. And one of the things I guess I would really emphasize is if you think that you want to try research, even if you haven't really tried research before, residency is a great place and a great time to try. Faculty really just want to engage you and give you a chance to try and experiment with science when you're in your training, with the hopes that we're going to convince you to become a pediatric nephrologist like myself, right? Somebody that does research and does clinical work as well. So if you're interested in research, consider applying to a PSTP if a program has it. Just because you may not have a PhD or other advanced degrees doesn't mean you're not necessarily not qualified. You sure could be. So, really, like was mentioned before, a passion for the process, a passion for learning, and just a willingness to try. But, consider applying to PSTPs. This is a great time in your life to do it.
Oh, okay. That's a great advice. Thank you so much.
You're welcome.
Thank you. Does anyone have any other question?
Yes, I do.
Okay.
Hello.
All right.
Yeah, thank you. Thank you to all the presenters. I am Anuchukwu, and my question is this way. I'm about 22 years post-graduation. I've been involved in clinical practice and research, and I've been practicing in Nigeria. There's no gap. What are my chances of applying and getting a placement in any of the programs?
I'm sorry, could you repeat the question portion?
Okay. I say I am 22 years post-graduation, and I've been practicing pediatrics for quite a long time. I have no gap in my practice. So I'm asking, what are my chances? I've passed all the steps exams. What are my chances of getting a placement into the program?
So that's a really great question that is very hard to answer without looking at your ERAS packet. And so I will say for us in Pittsburgh, we found the most success with applicants that have been graduated less than 5 years from their medical school training. And so those that have been out in training and independent practice sometimes have a harder time to transition into a larger program like ours, but I'm more than happy to hear from other programs about their experience with folks that have been out and actively practicing pediatrics for a number of years post-graduation.
This is Iyad Hanna. We're from University of Iowa APD, and I happen to be 22 years post-graduation myself. So, what we really want to know is gaps. You said no gaps, and that how are you going to handle the process of going back to training? Because that's going to be a difference and a challenge. So as long as you're thoughtful about that, then we'll look at the merits of your application and not discriminate against you because you're 22 years post-graduation also.
Yeah, University of Oklahoma, I think we would just add, we do look at each candidate individually, and I think as mentioned, I think it can be, that's an added challenge being so far out from training, having to make that transition back. But I think a good strategy is to articulate kind of what you've learned over that time, how you envision yourself transitioning back, and how it would all lead to your ultimate goals. I think having a good narrative behind is key. I think that's what we look for, is folks who've really thought about their goals are and how program can help them get to their goals. I think I'm not because it'll be fairly obvious, but work on how you're going to use that to shape how you hope to practice medicine, and how our program or other programs can help you get there.
I have a question for Dr. Nafee at OU. So I've heard about this parent elective. Can you tell me a little bit more? Like, what does that mean?
Oh my gosh. I was actually just joking with Sabrina Zion, who's on here, who's a friend of mine. She published an article about a new parent elective. It's Dr. Combs who works out at our the clinic that's based within our Latino Development Agency in Oklahoma City. It's called Super Niños Clinic, actually runs the elective, but really the intent is to protect a little bit of time for new parents, but also to give you knowledge on parenting so that it may help you counsel your patient's parents. So it is a callable elective in that residents do sometimes take call when they are on the new parent elective. And I might let Dr. Meenan, one of our chiefs, speak more to that. But really it is intended as a way to not prolong maternity leave, because it's not really leave, but for you to get some quality time with your baby and learn from them. Christina, do you want to add about call? I just am not exactly sure what that looks like.
Yeah, so it's typically like 3 or 4 weeks that you're on this new parent elective. And the way we do calls at our program is we have you're call eligible once or twice during that elective. So that would be like 2 different shifts, like a Friday night or a Saturday night. So it's really manageable. And a lot of residents in our program have grown their families and have used that elective to bond and then also learn and translate that.
And so I'm from the University of Iowa. My name is Casey. I'm one of the chief residents. We also have a parental elective, and I was able to use that after I had my daughter during my 3rd year. And it's been they're great opportunities to, we do like the 4 weeks that I was able to take were after my 6 weeks of exclusive maternity leave. And it was more of a gradual return back, which was really nice and very supportive for like figuring out how to pump and different things while I was like kind of transitioning back to work. So it was a really nice time to ease back into it and feel comfortable. But then also I got to pick a project that I learned more about because I was reading a whole bunch of things, even though you learn a lot being a pediatrician, there's a lot more to learn. So you get to pick a project that you present onto your co-residents. So it was really fun for me. I enjoyed having the time with my baby, but then also the time to learn something I might not have otherwise looked up.
Ours has been so popular that we've been challenged by our GME office on campus to adapt the elective to other subspecialty or other specialty residencies like internal medicine or family medicine, which has been a bit of a challenge, I think, because you can sort of justify it more easily in pediatrics or maybe family medicine. But I do think that it's kind of the wave of the future. And so again, I'm just going to speak to my friend Sabrina, who's in this room somewhere, I think, or at least she's on the webinar somewhere, who sort of published a paper on new parent electives and lays out pretty nicely what they should include.
Thank you so much. Does anyone have any other questions? All right. Anyone has any question? Okay, so I have a question, and I would like every program, we could just go across the board, beginning from University of Missouri. So how does your program help residents who are undecided in their career path as a pediatrician when they come into your program?
Thank you for that question. Again, this is Anish Tosh, University of Missouri. That's pretty frequent. We like the blank slate. Our goal is to expose all of our residents to as much of pediatrics so they can make the best decision for themselves and their careers. We actually just did this with our new interns that just started on July 1st. We are assigning faculty mentors. So all of our residents within the first month of training will have a faculty mentor assigned to them to help kind of shepherd their way. It's nice being a smaller program. We have 8 residents per year because they have a lot of access to senior residents, chief residents, and faculty and program directors to help them. So as our residents have clear ideas of what they want to do, whether it's general pediatrics or fellowship, and that we get them more involved with various aspects of preparing them for the next stage of the career. I will say one more thing: we offer mock interviews, which a lot of other programs do, to prepare our residents. And Varun, actually, as you mentioned, our chief resident is applying for child abuse fellowship. We're getting ready to prepare him and getting some mock interviews ready for him. We do our best, in our opinion, to prepare our residents for the next stage.
And just to echo some of the things that Dr. Tosh said, I would say as a personal narrative, I didn't always think I wanted to do child abuse. I honestly didn't know it was a fellowship when I started pediatric residency. I thought I was going to do NICU, and I did a bunch of NICU research, neuroimaging and whatnot. And like Dr. Tosh said, having a mentor in a small program didn't restrict me from being able to reach out to people in the NICU, other people, choosing different electives, talking to other people, having a small program at Mizzou. That's one of the strengths, I feel like, to be able to help you really explore if you are undecided. And I think that's one of our strengths of our program. And I think I'm an example of that.
So we are a large program. And so in our program, we have the great opportunity to be able to also pair our new interns with mentors, as I talked to you about in the Bridges program. So the Bridges program is named aptly because Pittsburgh is the city of bridges. We actually have more bridges in Pittsburgh than they do in Venice, Italy. And bridges connect our city and our communities. And our Bridges program connects our residents with their career path. And so we pair our residents with their mentor, and then that mentor joins the residents for all of their program director meetings to help as a coach and a mentor in the program director meetings as we continue to build a team. So the goal of our Bridges mentor is to provide transitional mentorship into residency and welcome them to the city of Pittsburgh and to Children's Hospital of Pittsburgh. They may serve in some research and career development paths, but their goal is to build a team around that resident so that they have the right career mentorship along the way. And so that may mean adding a research mentor and adding a career mentor if it's in a specialty other than where that faculty practices. And so by the end of their program with us, we've actually grown this mentorship circle around our residents so that they end up in the right career path, whether that is primary care in Pittsburgh or around the country, or whether that's a fellowship program along the way. And then we have career development curriculum that helps in that transition process also into primary care with CV and cover letter guidance, and then also for our fellowship applicants, CV, personal statement, ERAS, tips and tricks, and then some interview tips along the way. So we are lucky to be able to partner with many really passionate faculty in the Children's Hospital in the greater Pittsburgh area and pediatricians that are practicing in the community to help navigate. And I will say it's my personal favorite when residents come in and they are still pluripotent because this is our great opportunity to show them all the amazing paths that pediatric has to offer.
I love the pluripotent description of residents. I think that we like it too when they're undecided. People like Dr. Harshman can recruit them to nephrology when they work with her on subspecialty inpatient and outpatient floors and clinics. I think, as everybody has said, mentorship is really key, of course, and we pair residents with mentors upon entry to our program as well. I think of the other things that I think about when I remember our residents and their decision-making over time is the fact that they can do all these customizable electives. I had a resident who is now a neonatology fellow who helped design an elective where she was debating between neonatology and general pediatrics, which were so different. But she was able to make an elective where she sampled practicing those different types of specialties in different communities and in different settings. And so that was really helpful for her. Also, I think people can go away for electives if they need to. We have relationships with other programs to do specific electives and something that maybe we don't have here to offer. And then the other thing that comes to mind is our career day that we have for our second year residents as they're starting to think about those decisions with specialty applications coming up, to bring back some of our previous graduates who are either practicing general pediatrics or did fellowship, and let them share their experience about the decision making and their career choices.
So I think, similar to a lot of the other programs that have already spoken, University of Oklahoma also has lots of opportunity for people to experience different subspecialties and the general practices. I would also say that we're all in the Midwest, but really in Oklahoma, everybody's so friendly and accessible. I'm the awkward person that when I go to somewhere, I was recently in Boston, I walk down the street and I smile and say hi, and people think I'm nuts. Right? They're like, what? She said hi to me. Anyway, so I do think there is opportunity for residents to have conversations with faculty very often. I would also say that X+Y affords us a unique opportunity to get people short experiences in pretty much every single clinic that exists on our campus, as well as some inpatient electives that they don't necessarily have to commit a whole block to. They can do it for a couple of half days over a few months, so they get a variety of experiences in that area. The other opportunities that we have around is we have really strong relationships with some of our graduates who have gone into private practice, both in the rural setting around Oklahoma, but also within Oklahoma City, so in a very urban setting, and our residents do take advantage of some of those opportunities. We also have a unique relationship with our long-term care facility called the Bethany Children's Center that provides long-term care for children with special needs. They also have a rehab side, and so we do have our residents, every resident goes out there to experience what that type of medicine is like as well. We also love it when residents come in pluripotent, and I had to giggle a little bit because all of us nerdy people love those types of words, and it just makes me happy to be in a group that can appreciate that kind of language. I would say that it is really nice to have someone come in with an open mind and to get to watch them develop over time and really figure out exactly what it is that's going to make them happy enough and allow them to serve the community in a way that suits them best.
Just to add on to what Dr. Nafee had been talking about, I think there are a lot of residents that come in saying they, don't know what they want to do. We do have some residents that come in and actually continue with what they wanted to do. There's not a lot of pressure from the faculty saying, oh, you have to do this, or, oh, you wouldn't be really good at this. Everyone is very supportive, which I really appreciated. I honestly came in wanting to do general pediatrics and then was undecided for quite a while and kind of leaned on my PD and my co-residents and my coach, Dr. Hahn, who I had all 3 years. And now I am applying for hospital medicine fellowship. And so really it gives you a lot of opportunities at our program to change your mind and have support through all of that. So it's been really great.
Thank you so much. All right, so I have one more question. I'm not sure I heard any program talk about any global health opportunities, but could you tell me more? And this question is for every program. Could you tell me more about your global health opportunities? And if you don't have any of that at your program, are you open to incorporating one over the next few years?
Thank you for your question. Due to our size, we do not have a dedicated global health track. However, we've certainly had residents interested in going to other countries to learn and to give care. And so we've certainly been able to carve out elective time for residents interested. So we've certainly had residents travel, for example, with our medical students to other nations. So just because of our size, we don't have a dedicated track, but we're certainly open to it. I will say it's not directly answering your question, but we certainly allow other residents to go to other places as well for rural care, Indian Health Service, for example, as well, and also to get exposure to other programs if we're not offering a specific type of elective. So we certainly allow flexibility in our residents to get the training they need to be successful, including global health. Thank you for your question.
So we do not have a global health track either at UPMC Children's in Pittsburgh, but we do have affiliated international sites. And so UPMC is a large entity. really vets those sites for sustainability and safety. And I see we only have 55 seconds, so I'll let others answer this question before we get kicked out. So yes, we have global health opportunities. They are vast and they are global.
I will say that we had really a budding global health curriculum and actually travel in conjunction with our internal medicine program that died with COVID. And so we are totally open to rejuvenating the program, but it is a challenge.
Thank you so much. All right, so we are all going to be leaving the breakout room now to the main session. Thank you to every program that participated and to every applicant. All right, I wish everyone great nights and great season ahead, including myself. All right, bye-bye.
Afternoon, everyone. My name is Nina Mercado. I will be your moderator today. So this is room number 6, sorry. I am an international medical graduate from Colombia. I will be with you guys for today. So I would like to invite our programs to give a short presentations of their program for 5 minutes for the first part of the evening. And then we will take questions at the end of all of the presentation. Attendees, you can, however, leave your question in the chat as we go. We also encourage programs to make use the chat to answer any question that they have in case that we are run off the time. Okay. So I just want to be sure that we have that we are recording. So for the people that are not able to enjoy. Okay, everything is perfect. So with the first program, let me move this here. Okay, perfect. We have the Spectrum Health, Michigan State University, Helen DeVos Children's Hospital with Dr. Kira Siplingan and Susan Haynes.
Hi, everyone. And Nina, thank you so much for hosting our small breakout room here. Thank you all for joining us in the Midwest, Mid-America region. My name is Kira Siplinga, and I'm the program director for our residency. I also wanted to say a shout out to my chief resident, Elijah Huang, who's also on the call and in our breakout rooms as well. I wanted to take a moment to tell you a little bit about our program. We are located in Grand Rapids, Michigan, which is on the west side of the state of Michigan. We're the second largest city in Michigan, and we really do highlight the same things that our colleagues highlighted about the Midwest and Mid-America as a great place to live in Grand Rapids, great cost of living, lots of exposure to culture, diversity, outdoor recreation, sports, and all very easily accessible due to the size of our city. Within our city, we are part of a larger health organization called Spectrum Health Beaumont Health, which is one of the largest health organizations in the Midwest. But in that lies one of our favorite parts of that organization, which is Helen DeVos Children's Hospital. One of our favorite things about our hospital is the size of it, which is a full scope comprehensive tertiary and quaternary children's hospital with 234 beds. But despite that size, we still have that intimate and friendly feeling between residents and attendings. In fact, it's very important to us that we all call each other by our first names in order to really break down that hierarchy between residents and attendings. We have a handful of fellowships, but our fellowships really enhance the residency in that each fellowship really only has 1 to 2 fellows per class. And so most of your rotations you can spend without interacting with fellows. Some of them you will, which is a benefit as well. Our mission, as you can see there, is to create an inclusive and innovative learning environment that really impacts the health of the children of West Michigan and beyond. I think what I really would like to highlight about our curriculum is that it's my goal and our chief's goal and our faculty goal to create a curriculum that is individualized for what you guys want to accomplish. So primary care is about 40% of our graduates, whereas 60% go into fellowships either in the Midwest, here in Grand Rapids, or around the whole country. And we put you on a specific track for that. We also have some very creative faculty and residency leaders who have really helped enhance our curriculum with a wide variety of experiences, including leadership elective, global health track, a new lifestyle medicine certificate program is starting next year, as well as a culinary medicine certificate program. I think what I really also love about how our moderators earlier really highlighted the diversity of the Midwest, and we really do highlight that in Grand Rapids as well, and it's important to us within our residency program. So it's important to us that we are able to recruit a class of residents that represents the patients that we take care of, and then really support you guys when you come to serve our community. So it is our honor to host you here in Grand Rapids for at least 3 years, and it's really exciting when we find out that residents want to stay and contribute to Grand Rapids and impact the health of the children of West Michigan. I am happy to take questions later, but thank you again, Nina, for this opportunity. And I look forward to hearing more about our other programs.
Thank you so much, Dr. Cipligan. Here you can find the contact for the program in case that you have another question that you want to share with the program director, or also if you want to request more information. Our next program will be the Rainbow Babies and Children's Hospital Case Western Reserve Hospital in Cleveland, Ohio, with Dr. Kate and Carla Dinuncio.
Well, hello, everybody. So I've changed hats. I've left my APPD regional chair hat behind, and now I'm the program director for Rainbow Babies and Children's Hospital. And I've been at Rainbow for going on 30 years now. And so it's truly my home away from home. I'm really excited tonight because Rachel Welch, who is one of our current chief residents and one of my favorite people in the whole wide world, is going to be able to share with you some information about our program. Rachel.
Thank you so much for the introduction, Dr. Panitz. Thank you guys so much for hosting us. We're so excited to share a little bit of Rainbow with you all. As it's mentioned, Rainbow's right in the heart of Cleveland, which is right at the top of Ohio on Lake Erie. It's one of the 3 biggest cities in Ohio, which gives us a lot of access to so many big things that a big city has. As far as living in Cleveland, it's actually very, very affordable, and you can really take advantage of all the big city amenities while still living on a resident's salary. There's so many things to do outside. We have the Cleveland Metro Park, so there's lots of green spaces for hiking, for biking. And then we have the Lake Erie, so if you like water sports, there's that. And then there's also Playhouse Theater District, which holds quite a few theaters where you can see like top Broadway musicals. So there's kind of something for everyone in Cleveland, which is really lovely. As far as our patient population, Cleveland's centered in this really unique location where we get to see urban, suburban, and patients who live out in rural areas, including a very large Amish population. And then there is quite a few refugee and immigrant families that come into the Cleveland area as well. So I'd say we see quite a bit of diversity in Cleveland, which is really great for our trainees to really be exposed to quite a broad array of pathologies. So some of the things that I really love about Rainbow and why I wanted to come here and why I wanted to stay as a chief is I think there's so many things about the program that make it really unique so that you can have your training tailored to exactly what you want. We see all the bread and butter, so you get all the baseline training that you need, but then there's so many different avenues for you to really tailor your education for yourself and really kind of like step up and be ready for those next steps. One of the favorite things about our curriculum is we have a junior only inpatient team during your 2nd year, where you are not being managed by a senior and you're not managing any interns. You really just have time to take care of patients as like a solo resident, which is a really great step in that graduated autonomy to learn your strengths, your weaknesses, and really how you like to practice medicine. I think it's a really unique opportunity, and pretty much every resident I've ever talked to at Rainbow loves that rotation. Some of the other things that make Rainbow really unique is we have the 6+2 scheduling system. So you do 6 weeks inpatient followed by 2 weeks of outpatient. So there's always guaranteed time to really work on your outpatient skills as well as your inpatient skills and having some time off, which it makes for great resident wellness. as well as a balance in your educational opportunities. And then for as far as tailoring your education, we have multiple tracks here at Rainbow where you can be as involved as you want and really get a lot out of them. We have our research track led by one of our APDs where you can really focus on getting lots of great research, more than just your scholarly project out of residency. We have our med ed track, which focuses a lot on our medical education for all of our med students here at Case Western Reserve and also how to educate residents. We have our advocacy track, which does a lot of work in the Cleveland area as well as Ohio at large. And then we have our global health track, which is one of the longest global health tracks in pediatric hospitals. And we have gone to many different places as well as abroad and domestic. And so there's just so many opportunities at Rainbow to really kind of cultivate your residency, to really take you to that next step and be ready for fellowship or primary care. And I think it's all done in such an environment that's so caring. Everyone at Rainbow is really like very much part of that team atmosphere. And I think it's one of the things that makes our program so unique. So I'm so happy to share a little bit about our program, and please feel free to ask us questions.
That's so great, Dr. Walsh. It's so great that you can share your experience as a resident. I really appreciate that. It sounds so great. So here you can find the contact information from the program. Now we will pass to the next program, that is the Authority Health Detroit Wayne County Health Authority in Detroit, Michigan, with Dr. Pittman Hunt, Program Director, and Maisha Hussain, Program Coordinator.
Hi guys, my name is Sandeep. I'm one of the residents of Authority Health. I'm one of the recruitment chairs. So first off, just on behalf of our program director, Dr. Hunt, she was so excited about this and she was very sad and sorry that she wasn't able to make it tonight. But if you guys have any thoughts or questions directed towards her, we'll have her contact information later on. So you guys can contact her. And I also have Kirby alongside me, and she's also one of our resident chairs. So we just want to start off by saying the very special things about our program. Like Nina had said, it's located in Detroit, Michigan. So the heart of Michigan, you get to experience everything that a downtown urban population has, but also serving the underserved population as well. And it's also a huge referral center, so you get a lot of patients from the nearby suburbs as well. Our favorite thing about this program and why we chose Authority Health is because it's a very small, intimate program. It has that family-like feel, but you still get that exposure of a freestanding large children's hospital. So we do all of our training at a level 1 trauma center with a level 4 NICU, the Children's Hospital of Michigan. But then we also get to explore and really delve into the community of Detroit. Our continuity clinics, our ambulatory clinics, they're all at federally funded clinics all over the city of Detroit. So we really get to be one with the community of Detroit. We get opportunities to do outreach and community medicine. And I think that's something that's really special about Authority Health, getting that exposure at such a high level children's hospital, but also being engaged with the community. So we really get to experience all the racial diversity with our patient population and see very, very unique pathology presentations. Another special thing about our curriculum is that all the residents do a population health certification program through the University of Michigan. So that just highlights more about population health. And we also have a diversity and racial disparities education program. And that's something that we do every month. It's with family med, pediatric, psych residents, and we just talk about all the different disparities that we face in the world and through residency. So I really appreciate the fact that Authority Health takes into consideration everything that's happening in the world and in medicine. So like I said, our curriculum really allows you to have that outpatient outpatient feel and inpatient feel with ambulatory blocks and inpatient blocks. We also have 5 to 6 wellness days per year, which is amazing. So a lot of balance. And we have diversity not only in our patient population, but in our residents, whether it's DOs or MDs, international graduates. So there's a diverse population of patients and residents attendings. So it's very inclusive, which I appreciate. And like I said, Detroit is a great place to live. You can live in the suburbs, you can live downtown. It's very affordable. You're so close to so much nature in Michigan, which is one of our favorite things. And we just love having a smaller, intimate feel in a bigger setting as well. So if you guys have any questions, please feel free to message our program coordinator, and you guys can also contact us on Instagram and follow us on Instagram to see more about what we're about.
Excellent. Thank you so much, Dr. Sandy. The curriculum of the County Health Authority sounds so great. Our next program is the University of Illinois College of Medicine, Peoria, with Dr. Candy Katu, Program Director, and Tammy Livingston, Program Coordinator.
Thank you. Hi, everyone. My name is Bhavna Kandikatu. I'm the Program Director here at UECOM's Children's Hospital of Illinois. We are super excited to be here. Thank you for the opportunity. I have here with me 2 of my awesome residents, Rustin Cashel, who is a PGY1, and Aluchi Okonkwo, who is a PGY2 and Rising Chief. We also have here our Office Support Specialist, Kelsey Webb, who's joining us here as well. We are a mid-sized program in the heart of Illinois. We are the largest children's hospital in Central Illinois. So instead of me telling you more about our program, I'm going to pass it off to our awesome residents who are going to tell you about our program.
Thank you, Dr. Kandikatu. So like she said, I'm a rising chief, going to be chief next year, and just wanted to focus on some of the highlights of our program. So we have 137 beds at our children's hospital, and we are right in the center where we get a lot of referrals from St. Louis, Indiana, sometimes even from Canada. So we are a tertiary hospital that sees a lot of pathology coming through. Each of our classes have 12 residents per year. And we did just start our X+Y schedule, which is a 3 weeks of rotation. So that could be inpatient or an elective, and a Y week, which is our clinic week. We also have what we call a specialty procedure and didactic session, which is every Friday afternoon, where we focus on inpatient topics or inpatient procedures that we wouldn't normally get a chance to do depending on how the rotation is going. So we get a chance to practice those skills regardless of whether we're going into clinic, fellowship, or outpatient stuff. We have an individualized curriculum where we can pick the kind of stuff that we want to, we want to do with each of our electives. So which I think is really good, because then you can tailor it based on what you want to do and based on what passions that you have as you go along your residency. We also have a DEI curriculum, which is a diversity curriculum, which Dr. Kandikatu will talk about in more detail towards the end of our section. Like I spoke about, we have a lot of care, we have a lot of patients, a lot of volume of patients. And then we also have another thing that is really special about the program is we have a board review curriculum that we have every month with one of our heads of education, and we're able to go through all the topics in preparation for boards at least twice. And we go through articles and we go through questions together. And I think it's a good way to kind of prepare us to go for boards while we are, in a very intense program. We still get some time to actually prepare for our boards. Another great thing about our program is that we have flexible vacation. So we have with our X+Y, we have weeks where we can pick our vacation and we can take it a day at a time. We can take it 3 days at a time. We can take it 2 weeks at a time, which I think is really good based on, if we have a lot of international students who have to go home, and, it's good to take that longer break at a time to go see family. Other things we have is that we have a cafeteria with free food, which is always great. You don't have to worry about doing some grocery shopping and stuff, because you get to get all that you need in the cafeteria. Other things that we have covered parking, which is free for us. We have a lot of resources for studying, med study cards and question banks and all of that stuff. And then we also have a mentorship program where we pick a mentor at the start of our intern year, and we meet at least twice a year officially to kind of see how we're doing. And we can always pick mentors unofficially as we go on our way through our residency program. So there's a lot of people who are looking out for you and guiding you through your residency program, which I think it's great. Cost of living is amazingly low, which is wonderful. Especially I did my medical rotations in New York, so the price of living here is amazing. So I love it here. And Peoria has also been voted #1 city to living in Illinois. So it's really good because you have places like Chicago that's close by, Indiana, St. Louis. So it is great.
So going on, and I just wanted to emphasize a little bit on that curriculum aspect that my wonderful peer was talking about. So this X+Y is something you may or may not have heard of. It's actually one of the biggest things that drew me to this program when I first applied. And it's this idea of this 3 weeks of the rotation followed by 1 week of clinic, or in my case, personally, it's 1 week of clinic at the start of all of my rotation blocks. And what that means is not only this opportunity for that slightly easier week, depending on what your rotation is to follow, but it means that I have this established continuity opportunities for my patients every single month. And while I'm not hosting clinic every week, if there's situations where I need to follow up with a patient down the road in a month, but they're only available on Mondays, I'm still able to see them. Tuesdays, I'm still able to see them because we have those clinic days available every single day. And it also offers opportunities to not just be in continuity clinic, but spend time in private practices and also in our illness clinic. And then at the same time, we have those 2 protected days. So one of them is an op education, so that's our outpatient education, and it focuses on topics like the last one was all about ear exams and what you're going to see in your outpatient clinic, situations that you may not necessarily always encounter with really obscure findings. And we have that protected time to really talk about it. And then the SPD session, which for us is on Friday afternoons. It's a great way to kind of round out the week, and we get to summarize some of the topics that we've been talking about, and then follow that up with the procedures. This last case, we talked all about spinal taps and what it really takes to land a good one, followed by practicing on the mannequins. We had our hospitalist fellows present to help teach us along with the attendings, and so they were able to provide some newly learned knowledge on top of that kind of long learned experience from our attendings. So it truly is a wonderful setup.
Thank you both so much. And to wrap us up, just to share a few of our diversity initiatives, we have a DEI committee and a council at both the graduate medical education level as well as the program level. And our residents not only get to be on these committees, they also hold leadership positions on these committees. Next week, we're kickstarting this year's monthly curriculum that covers a diverse range of topics such as racism in medicine, street medicine, LGBTQ+ healthcare, opiate use disorders, microaggressions, trauma-informed care, etc. And next month, we are having our very first DEI potluck in the Department of Pediatrics. We're inviting everybody to bring a dish that represents their culture and do a presentation about the dish that they brought as well as some invited external speakers as well. So thank you for this opportunity.
Thank you so much for the program. Looks so amazing. I guess that everyone will be like a little, will have like a little hard time trying to decide where to apply, because every program it's have their own highlights, like oh my gosh, I want all of them. Okay, so our next program is the Charleston Area Medical Center, West Virginia, University of Charleston, with Dr. Sharon Isfan, Program Director, and Ms. Amanda Mullins, Program Coordinator.
All right, so my name is John Frona. I'm the Department Chair here at Charleston Area Medical Center, West Virginia University. And I'm presenting tonight on behalf of our program, as Dr. Isfan is unavailable. But I wanted to share with you guys a few things. I mean, first of all, as I put in the chat, it is really some amazing programs in this whole region. I've spent my entire career here in this region. I was a resident and then program director for MedPeds at the University of Michigan, and then more recently at the University of Wisconsin, and moved down to West Virginia here about 9 months ago, and spent my life in program director stuff. And so these are really some amazing people in this region, and you really can't go wrong choosing any of these programs. I think for our program and kind of what drew me here was a couple of things. One was the amazing people, both inside the hospital as well as out in the community. People in West Virginia are just very friendly. They're willing to kind of go out of their way. You know, I was at a restaurant and I was looking for some strawberry jelly, and one of the other customers there just, you know, helped me find some strawberry jelly. So it's just this kind of people. I think the people that we have within our program are really amazing. The residents are a very diverse group. We have students who have done osteopathic training. We've had international medical graduates and U.S. medical graduates. We have 7 per class, so it's a relatively small program, and we have a small hospital, but we are freestanding. All of our specialties are represented, and we have specialists in all the different areas that you can rotate through with over time. I think the faculty here, a number of them either have trained here, including Dr. Isfan, who was a resident here a few years ago. A number of people have gone on to do fellowships and then have come back because they really enjoy working in this area and with our population. As you can imagine, with a more underserved population like we see in West Virginia, there's a lot of need here. You know, a lot of our children are taken care of by their grandparents or single parents, and so they have higher needs. So a lot of our diversity comes from the more rural, impoverished population. So we have a lot of the challenges that go along with those populations, but we also have a lot of patients, you know, from the area, and so it ends up being a very diverse population as well. We have, you know, a reasonable size proportion of African American patients, as well as urban, rural, and suburban patients. Slightly smaller Hispanic population. There are some Spanish-speaking patients here, and we do use translators for a number of patients, both on the inpatient side and the outpatient side. I think in terms of the things that you will get from our program, as you can see here with our curriculum, we have 13 blocks per year. As I mentioned, you get to rotate through all the specialties. Dr. Isfan is actually one of the child abuse pediatricians here in the state, and we are the only site in the state that has child abuse, child advocacy center. And so you'll get a lot of exposure, even some challenging situations, but you definitely learn about caring for patients in those settings. We also have a lot of individualized electives, and our residents do an amazing amount of scholarly activity, both research formally as well as more informally, and a chance to do presentations both regionally and nationally. There's a lot of opportunities actually within the state, both the state AAP chapter as well as some of the other regional meetings, and our residents always are attending and often winning the awards for the research that they do here. We just started an interactive case-based academic half day on Friday afternoon, similar to some of the other programs that really is focused more on what you need to know as a generalist. Go to the next slide. So in terms of our program, so we do have a freestanding children's hospital. It's actually women's and children's hospital here. It's part of a 3-hospital medical center that takes care of a large portion of the western and southern portion of West Virginia. Our residents are awesome. They're really a fun group and really amazing life stories that they all bring to their program here. We collaborate closely. There's other residency programs here, obviously, in terms of behavioral medicine or psychiatry, family medicine, internal medicine, surgery. We do not have any fellowships here, so you get to be on the front lines for taking care of all those patients. I've always said that there's, you know, mixed views of how you want to do that, but I think it's a nice model here. And our residents really, they're kind of the front line. They take the calls for transfers from other hospitals. They manage the ICU patients. They take care of all the patients. So by the time, even in their second year, they're developing a lot of autonomy and a lot of independence. But definitely by the time they're a third-year resident, they're very competent to go out and practice. And about half of our residents do fellowship training, half do general pediatrics. And then obviously being a rural state, we get a lot of opportunities to do rural health training. Not too far outside of Charleston, which of course is the state capital. There's areas where our residents will rotate and get additional experience, particularly if they're interested in more of that underserved rural population. And we do have a lot of our residents that come from, you know, Virginia, West Virginia, Ohio, different kind of more rural areas, and they really find the training here valuable. think the other thing that I would say, both that I've experienced and I think the residents are pleased with, is the way that they feel like they're needed by the patients. You know, when I was in these other institutions, big places, I felt like if I left, nobody would really notice, you know, whereas here, the patients need us and are very appreciative of the care that we provide here at CAMC. So I think it's a great chance to learn, see a wide range of patients, and really make a difference for those patients. I'll just, we do have the diversity initiatives, multicultural potlucks, which is awesome. The food that people bring is really amazing. And a lot of ongoing activities and opportunities for residents to participate in both departmental and institutional initiatives. I'll just say, you know, my goal for residency training is that people feel supported and feel driven. So we want this to be the best program, and we look for ways to kind of improve all the time, and our residents are a big part of that. There's a lot of opportunities for input and a lot of opportunities for growth. So if you come here, we will help you take your passions and your skills to the next level. So thanks also to everybody for allowing us to participate. Come see us in West Virginia. Look at our website. We've got a lot of great outdoor activities and things that make this a great place to live and work. So thank you.
Thank you so much, Dr. Frona. It's so good to hear all these highlights from the programs. We really appreciate that you can share with us what is the importance and what every university can, or every hospital can offer to the applicants. That's so amazing, especially because all of you are trying to keep on mind about a diversity. That is a good point to touch this year, especially with all the problems that are happening around the world. Thank you so much for sharing your time with us. We still have 10 minutes until we can come back to the main room. So I don't know if maybe someone wants to share something additional to the presentation.
Yeah, or if any of the applicants have questions, we're happy to kind of give you our perspective as representatives from different programs.
I actually have a question for Dr. Siplinga. I hope I said that correctly. My name is Nisha. I am a non-US IMG from South Africa, and I'm currently doing my clinical rotations in New York City. So your program mentioned that it had a global health track. So I just wanted to know which the last place was that you actually had a global health initiative, and if you have guaranteed funding for that initiative every year.
Well, thank you so much. I apologize that my internet is a little spotty, so I understand my audio is going in and out. But fortunately, I have our chief, Elijah Huang, who is part of our most recent international trip, which we were able to resurrect after COVID. I'll give you a brief line and turn it to him. But Eileen Aldrich is our Peds ID doc who leads our residents through a 18 months or 24 months, Elijah, you can help with that curriculum that allows all the residents to go through once a month different topics related to global health. She also has a partnership with MSU College of Osteopathic Medicine, which has established locations in different venues. And I'm going to turn it over to Elijah to tell us a little bit more about what he did.
Yeah, can you guys hear me? Okay, perfect. So yeah, I believe it's an 18-month certificate program for the global health program that Dr. Aldrich has revamped for us. Most recently, we went to Mexico down in Merida, and that was an established partnership through Michigan State University. So that was great. We had about a 2-week trip down there, but we try to provide a month-long trip, and that counts as one of your electives. And since it's part of our track, if you can do a global health track, it is part about your residency, so you can get paid during that time with the same resident salary. I know from the Med Peds side, which we've sometimes crossed paths with, they've gone to Costa Rica as well. And one of our hospitalists, well, prior to COVID and outside of any civil unrest, has a long-term partnership with Haiti as well. So I know a lot of, there's a long legacy of our residents going there as well. But there are plans to expand as well. We had a long list all over the world. So really, if you wanted a new site, you could definitely plan it out and set your objectives. And as long as it passes the curricular requirements from our end, then we are happy to help set it up as well.
And in addition to the international rotations, we also value the local component of international health. And so we ask our lifestyle medicine track folks to do what's called a local international, where they focus on refugee and immigrant health, as well as the health of our underserved populations right here in Grand Rapids.
Yeah, I was just going to add, there's a lot of programs actually in our region, the two regions here tonight, that have done some really interesting stuff with global health. There was a collaboration between the University of Minnesota, Wisconsin, and Madison, as well as Milwaukee. Obviously, Northwestern has a big program. Indiana has a big program. I don't want to mention too many because I'm going to miss some for sure, but it's a very strong opportunity. And so I think if you're interested in that, kind of learning more about the different programs and what they offer. And I think, you know, as I've watched this over many years, there's a lot more focus on Dr. Ciplinga is talking about, where it's, you know, not just the international stuff, but it's working with patients in limited resource settings, even close to home, and working with refugees, and you know, just really helping people think about the whole scope of things. So it's not just, you know, it's not medical tourism like some people talked about before. So I think if you're interested in that, there's a lot of great opportunities throughout the region.
Thank you so much.
Okay, perfect. Thank you so much. So we can start to come back to the main room. The other room are still waiting to finish their presentation. We finished a little early, as well as 2 additional room. So we can come back, or if you want, we can spend 5 minutes more, answer some questions.
I'd say we should just kind of talk here a little bit more. Just I'd be interested in what the applicants are looking for. We heard from the one with the global health, but are there other things that are important to you guys, or what are you trying to weigh when you're listening to these presentations? I know you're supposed to ask us questions, but I'm good at asking you guys questions too.
I don't know about the other applicants, but me personally, I obviously need to look at programs that are sponsoring J1 visas, as I'm a non-US IMG. And I think I just look at resident support. Like, I think a lot of the programs have some great things, like the resident wellness days, and a well-integrated resident community is definitely something that I would look for in a program.
Yeah, thanks for sharing that. I think that that is a key piece, and it's sometimes one of the concerns I think people have is that, you know, in these virtual environments, can you really assess, you know, how well you'll connect with the other residents? And I think what I've seen over the last couple of years, and you know, is if people do have open houses, to try to attend those, to kind of meet more of the residents, there will be opportunities to kind of connect with the residents, and just trying to see, you know, how do you fit in? Because that's really, you know, people could talk a lot about faculty and, you know, the hospital and all that kind of stuff, but you're going to learn probably the most from your colleagues. And so finding a place where you feel like there's good connection for what you're looking for, I think it's probably one of the key pieces. So as best you can, just, you know, even asking programs kind of what do they look for in applicants. You know, that's actually, I think it's nice that our region directors kind of talked about the values, because I think if you find a place that aligns with your values, you'll be in really good shape to learn a lot and connect with residents. So the good thing is there's lots of good programs, and lots of good programs that, you know, take J1 visa holders as well. So I think just look around, kind of try to explore things. You know, if there's opportunities to connect with residents, and for speaking to you specifically, like with the global health interest, you can definitely, you know, ask programs to connect you with residents who are in that track, and you'll be able to figure out if it's a place that works for you.
I just have some advice for like the applicants. So both Sandeep and I were one of the first class that went through and did virtual interviews. So we're second years this year. And one thing that I noticed is that, you know, a lot of the residencies have a lot of the same things. We're required to have a lot of the same things in general. But one thing like the rest of the group was saying, look at how the residents interact with each other. If you can go to either the welcome dinners or the basically like the Zoom sessions beforehand the night before, that's going to give you a lot of information about how the residents interact and how much they like the program and how much they like each other. And that's a huge thing in general.
Yeah, and I think just adding on to that, another thing that I realized is seeing how involved the residents are, either with recruitment or interviews, or just in the program itself. A lot of programs have different leadership roles where the residents themselves can get involved with, and I think that's really nice because that shows that a program is really willing and open to a resident's feedback, and it's a very close-knit environment.
Yeah, you know, to that point, John, you know, it might be worth sharing with the group a little bit about the recommendations from the Association of Pediatric Program Directors about how we're going to interact with the residents, or the applicants, about second looks, those kinds of, you know, key issues that that we're going to try and really have some equity around how we go about bringing you guys in to see our programs.
Yeah, that's a good point, Keith. I think so. We've worked really hard over the last couple of years, and I think one of the strengths for the PEDS program directors has been around equity, to try to make sure that the process is equitable for everybody. You know, so we really discourage second looks. We've been out in front on that for a lot of years, but even more so in this virtual world. You know, if people want to visit the city, because we know you're going to be living in a place for 3 years, we've encouraged programs to develop, you know, some little, you know, tips and things for navigating the city, or kind of looking around, getting to know the place where you might be living, but really trying to keep it equitable, even for people within the same program. We're also focused a lot, as you may have heard, of one of the first sessions on the holistic review, and not just looking at, you know, board scores or grades or things like that, but really looking at the fit and the connection with people in the program. We've really just tried to, I think we've been pleased with some of the surveys that we've done with FuturePedsRes and others to see that we are achieving those goals, that, you know, we're getting people into good programs, we're matching good residents into programs, and we're also keeping things equitable, both, you know, obviously financially, even looking at things like the, you know, impact on the environment, you know, with having fewer people travel. There's just a lot of reasons that, even though there's some small disadvantages, and certainly was a lot of anxiety the first year that we did virtual interviews, this has been a really good process. And I think PEDS is, I'm really proud to say that PEDS has been leading the way on a lot of these initiatives. So I think you're in a great field. You know, you'll get the hang of this. It works out really quite similarly. You'll get to meet lots of cool people, get to know a lot of the programs. And so I guess that's what I would add to some of those comments. I don't know, Keith, if you got other things that you want.
You know, I think the only other thing, you know, that was kind of on my mind that I think would be helpful for these guys is, you know, we're going to be, you know, doing signaling in pediatrics for the first time in this upcoming year. And so everybody's going to be figuring it out together. But I think this is a true statement. The majority of people who we at Rainbow ultimately invite will be people who we actually don't receive necessarily a signal from. And so because you guys only have, I believe, 5 signals is how many you're going to be able to send your signal to. And so I still think, I think, you know, because you're going to spend a lot of time thinking about who do I signal to, and I would encourage you to, I think it makes the most sense to send it to the programs that you want to go to the most. But I still think, and see what other program directors think, I think the majority of our interviews will be coming from people who we didn't signal. So don't worry if you haven't sent us a signal. We'll look at your application. That's true for, do you guys think that's true in the other programs?
Yeah, I think so. I think I forgot about that aspect because that's a new thing this year. But so that does make things a little bit more stressful or uncertain, especially for students that maybe don't have a whole robust school infrastructure to kind of advise you about that. So you can reach out to any of us as program directors. I'm sure we'd be happy to connect with you and give you advice on that. So just let us know.
All right, well, I think we're going to quickly get pushed out of here. So on behalf of the Mid-America and Midwest regions, I want to thank all of the program directors and the FuturePedsRes residents. We're really excited to get to see you here in just a couple months. Bye, everybody.
All right, well, welcome back, everyone. I just want to give a big thank you to all the program directors and program coordinators and the residents who are here. Thank you guys all so much for taking the time and presenting to us. I know that this information is invaluable, and as we all learn and try to get through this process, we're so grateful for you guys taking the time. So I just wanted to put that out there. Program directors and coordinators, you are free to go. You may reclaim the rest of your night. Have a wonderful night. Thank you so much for joining us. We will keep the residents if possible, and we'll transition into our resident happy hour. All righty.